We shall now have an opportunity for silent prayers and meditation. Thank you very much. We may take our seats. Good morning, honorable members. I take this opportunity to greet the Honorable the Premier, Dr. Popira Matuba, in absentia, greet honorable members of the Executive Council, MECs, greet the Deputy Speaker, Mete Romamrovela, greet the Deputy Chair of Chairs, Ntate Ngobeni, the Deputy Chief Whip, Honorable Manama, and the entire Whipari. Greet all chairpersons of committees and all honorable members of this August House, and greet HODs that are present here today. Greet those that are in the gallery, our guests. You are warmly welcome, and as well greet our followers on social media platforms. Good morning, everybody. We are now starting with the sitting as scheduled now, and we shall go through our own order paper of the day. I must take this opportunity to inform the House that you should not be surprised. We have received an apology from the Honorable the Premier. We have received an apology from Honorable Mukhonyana, who is the Chief Whip. We have received an apology from the Chair of Chairs, Honorable Mkoni. Thank you. Welcome, Premier. I was still indicating that we did receive information that you will join us. And we must indicate that we were informed that we received the apology from all members of the Economic Freedom Fighters, all members of the Democratic Alliance. Apology from MKP, Ntate Jack Felile, as well as from Honorable Sebotuma. Those are apologies that we've received this morning. We did receive other apology from other members of the legislature, like your Honorable Libya, Honorable Munisi. Yeah, those are the apologies that we did receive. We as well received apology from MEC Radzilani and MEC Mate. I'm not sure if MEC Health is joining them. They will leave the sitting while we are on because they are proceeding to go and deal with the matters of national interest. They are visiting Musina. So as and when you see them leaving their house, you must know they have apologized. Item 2 are the motions without notice in terms of House Rule 145, none. Are there any notice of motion in terms of House Rule 146, none. Are there any statement by members, Rule 199, none. Is there any member who have got a member statement that I might not have received myself? We're still at item 4, Honorable MEC. None in terms of Rule 199. We're now at item 5, statements by executive in line with Rule 200. We have received information that MEC for Agriculture, Me Nakedi Kekana, she has got an executive statement. Over to you, Honorable MEC.
Thank you, Honorable Speaker, Honorable Premier, members of the Executive Council, the Chief Whip and the Whipari, Leader of the Opposition Party, the Chair of Chairs, Honorable members of the Legislature, Thobela. I stand before this August House, Honorable Speaker, to exercise the Limpopo Department of Agriculture and Rural Development constitutional oversight mandate, delivering Okay, sorry. I stand before this August House to exercise the Limpopo Department of Agriculture and Rural Development constitutional oversight mandate, delivering a definitive account of ongoing battle against foot and mouth disease. Armed with a revolutionary mandate to drive an inclusive economy under the stewardship of Dr. Popira Matuba, I hereby present a transparent, up-to-date status report on our interventions against the foot and mouth disease that has been classified as a national disaster by the President of this country, His Excellency Cyril Ramaphosa. To date, our provincial teams have conducted 524 rigorous outbreak investigations to confront this biosecurity challenge head-on. Out of these comprehensive field operations, 95 cases have been confirmed positive. Honorable Speaker, the department is pleased to report that our comprehensive statistical scorecard indicates a highly proactive field-driven counter-offensive, registering lowest cases, outsmarting other provinces in the country. The department had received 775,660 vaccine doses, and we have successfully vaccinated 520,185 animals across the length and breadth of our province. This campaign has now been active for 28 weeks, averaging 18,578 animals vaccinated per week, with minimal spillage only 0.41%, well within acceptable field management parameters. The current data shows that 264,914 animals have been vaccinated in commercial farming areas. This accounts for 53% of our total coverage, successfully securing our provincial export corridors and macroeconomic stability. Equally important is our rural footprint. A further 212,396 animals have been vaccinated in communal areas, accounting for 41% of our efforts. This intervention directly shields smallholder communal farmers who are highly vulnerable to financial devastation. Meanwhile, 42,875 animals have been vaccinated in emerging farming areas. Presently, 387,036 cattle for 86. No, sorry. Sure. Sorry. 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 I'm lost. I'm lost. Honorable Speaker, presently 387,036 for cattle only have been vaccinated, representing 83.6% of all vaccinated cattle across our regions. In our parallel buffer campaigns, we have also successfully vaccinated 73,359 pigs, 1,869 goats, and 868 sheep. The procurement of 250 RFID tags valued at 10,720,000 is underway to tag the remaining 241,236 cattle during booster rounds alongside the 219,603 already tagged. Honourable Speaker, the department assures this House and the people of Limpopo that we are managing this outbreak with the agency, legislative focus and transparency it deserves. We will protect the herds, we will secure the markets, and we will ensure that Limpopo remains an agricultural powerhouse. I so move, Honourable Speaker, and my apology for the glitches.
Thank you very much, Honorable MEC. In line with the Rule 200, I will allow political parties to give their inputs based on the executive statement that has been made. I will allow Honorable Moss to come and give the observation. You need to come to the front, yeah.
Thank you, Honourable Speaker. Thank you, Honourable MEC. All protocols observed. Although we really are glad about the efforts that the department made and the inlands and the vaccinations is on course, we were just very disappointed at a national level that it had to come to this. A lot of farmers, a lot of people economically is not viable anymore. A lot of people have lost all their animals, and a lot of farmers are still actually at the economical disadvantage because of this. But we do appreciate the efforts that's been made. Thank you.
Thank you very much. We'll allow the African National Congress, the Deputy Chief Whip, Honorable Munama.
No, thanks very much, Honorable Speaker, for the opportunity to give an input and response to what the Honorable MSc for Department of Agriculture and Rural Development has indicated. As the African National Congress, our understanding is the foot and mouth is a highly contagious, severe viral disease that affects cloven-hoofed animals. And we are very impressed by the concrete interventions that the provincial government has initiated to ensure that they cap the spread of this disease. But also, we are more humbled as the African National Congress that this is the province that is making major strides in terms of this is number one in the country. And it can only happen where the ANC is in full power. And we really appreciate the efforts, MSc. You have all our support. Continue to assist, more especially the people. We know that our province is a predominantly rural province where farming, subsistence, and commercial is one of the issues. But also, as and when we are experiencing the diseases of this magnitude, it has an impact or a propensity to affect our economic growth and development in terms of the economic development trajectory that we have as a country. We fully support the intervention. Thank you.
Thank you very much. We really appreciate Honorable MEC, and we hear that even political parties support the good work that you are doing. Thank you so much. We now proceed in terms of the order paper. We're at item 6. The tabling of any committee reports and other reports and papers. 6.1, retabling of the 2026-2027 annual performance plan of Department of Coxta. We are told that MEC Mawai will be presenting on behalf of the MEC Makamu.
Honorable Speaker and Deputy Speaker, Honorable Premier, fellow members of the Executive Council, Chief Whip and the Whippery, Chair of Committees and Deputy, all members of the House, good morning. Honorable Speaker and honorable members, I, Khabu Mahwai, on behalf of my colleague, Honorable Makamu, arise to retable the annual performance plan of the Department of Coxta for the 2026-27 financial year. The purpose of retabling this APP is to seek the approval of the legislature for a limited number of technical amendments that will improve the accuracy and alignment of the document already presented to this August House. These amendments include the correction of the Oversight Committee reflected in Part B, the alignment of quarterly targets for 6 performance indicators in Program 3 and 4, respectively, with approved technical indicator descriptors, and the removal of the provincial indicator relating to the provision of social amenities under Program 2. I wish to assure this House that these amendments do not at all alter the department's strategic priorities, policy direction, or annual performance commitments. Rather, they strengthen the integrity, consistency, and credibility of our planning and reporting framework, ensuring full compliance with applicable planning requirements. I therefore respectfully request the House to consider and approve the retabled annual performance plan for the 2026-27 financial year for the Department of Coxta. Thank you, Honorable Speaker.
Thank you very much, Honorable Mawai, presenting the report on behalf of the MEC for Coxstar, MEC Makamu. The 2026-2027 Annual Performance Plan for Department of Cooperative Governance, Human Settlements and Traditional Affairs is referred to the Portfolio Committee of Coxstar for consideration and report back to the House. Item 7, Orders of the Day. 7.1, consideration and adoption of the following reports of the Portfolio Committee of Health. Chairperson, Honorable Thabo Maboja, the chairperson of the committee. You are no longer acting. Over to you, chairperson.
Thank you very much, Speaker, and greetings to you, Madam Speaker, Deputy Speaker, Honorable Premier, members of the Executive Council, members of the Portfolio Committee on Health that I lead, and greetings to you, members of the House. Speaker, I would like to move for the House to consider and adopt the 2025-26 second quarter report of the Department of Health as a report of this House. Thank you.
You may sit down. Can I please have a seconder to the report? Honorable Kupa Mabuza.
Thank you very much, Speaker. I stand to second the report that was presented by the newly elected chairperson of Health. Thank you very much.
Thank you very much, Honorable Chair. You can proceed 7.1.2, 2026, 25-26.
Thank you very
Third
much,
quarter
Speaker.
report.
Thank you very much, Speaker. Speaker, I would like to move that this House considers and adopts the 2025-26 third quarter report of the Department of Health as a report of this House. Thank you.
Thank you very much, Chairperson. You can now take your seat. There, yeah. Honorable Siwapela, seconder to the report.
Thank you, Speaker, and good morning. I also want to second the presented report by the newly reconstituted chairperson of the Portfolio Committee of Health.
Thank you very much. Today is going to be, I thought Ma'am Violet will help me. We call it what? Today you are going to be, yeah. Today, Honorable Chair, Honorable Maboja, when he comes to debate here, he will be doing his maiden speech as the chair of the Committee of Health. Thank you so much. We shall now refer to the speakers list. The honorable member who's presenting the debate, opening the debate, is Honorable Nkonyana Bongani Abednego. Honorable Nkonyana, you have got 10 minutes.
Thank you, everyone. You may sit down. Honorable Speaker, Makoma Makurupech, Mutusha Muspika Ramete Bomamrovela, Mutlacha Chief Whip, Tate Kanyani, Honorable Rogers Munama, not Makama, the Premier, members of the Executive Council, the unifying chairperson of the Portfolio Committee of Health, Rema Bucha, the MEC of Health, Mema Shiro, chairpersons and members of this House, and most importantly, the Wipari. Madam Speaker, the ANC rises in support of the adoption of the Portfolio Committee on Health second and third quarter performance reports for the 2025-2026 financial year. These reports provide a fair and balanced assessment of the departments of health during the period under review. They acknowledge progress made in expenditure and revenue collection, while also highlighting challenges that require urgent intervention, including shortages of healthcare personnel, infrastructure backlogs, pressures on medical emergency services, long waiting times, and the need to strengthen nursing education and mental health care services. As the ANC, we remain guided by our commitment to building a quality, accessible, and people-centered healthcare system. Healthcare is not a privilege for a select few. It is a fundamental right enshrined in our constitution. We therefore support measures aimed at strengthening primary healthcare services, improving healthcare infrastructure, investing in healthcare workers, and ensuring quality healthcare services for all our people. Madam Speaker, the transformation of healthcare is inseparable from the ANC's vision of a capable and developmental state. A developmental state must actively intervene to address poverty, inequality, and underdevelopment, while ensuring that public resources are directed towards improving the lives of our people. In this regard, the NHI remains one of the most progressive reforms undertaken by the democratic state. The NHI seeks to ensure that access to quality health care is not determined by one's income, social status, or geographical location, but by the simple fact that healthcare is a right that belongs to every South African. The strengthening of public healthcare facilities, the employment of healthcare professionals, the upgrading of infrastructure, and the implementation of the NHI, they all form part of the broad task of building a capable state that serves the interest of the working class, the poor, and our vulnerable communities. Madam Speaker, as a former leader of the ANC Youth League, I wish to emphasize the importance of youth development within the healthcare sector. The future of the healthcare depends on the opportunities we create today for young doctors, young nurses, pharmacists, therapists, emergency care practitioners, and healthcare administrators. We cannot build a capable state while qualified young healthcare professionals remain unemployed. We must accelerate recruitment, training, development, and retention of healthcare workers, particularly in rural and underdeserving and underserved communities where their skills are needed the most. As the former president of the ANC, O.R. Tambo, reminded us, that a nation that does not take care of its youth has no future. These words compel us to place young people at the center of healthcare transformation and development. The Department of Health continues to do well in employing young professionals as CEOs, as heads of departments in institutions, as senior clinical managers, as nursing services managers, and in all senior roles. Madam Speaker, the recommendations contained in these reports provide a practical roadmap for improving service delivery, strengthening accountability, and ensuring better healthcare outcomes for our people. Their successful implementation will require ethical leadership, disciplined administration, and an unwavering commitment to serving the people. In the words of the former GS of the SACP, the things that will destroy us are corruption, nepotism, and selfish leaders who seek to enrich themselves at the expense of the people. These words remind us that every resource allocated to healthcare must be used for its intended purpose and for the benefit of our communities. Chairman Mao taught us a simple but profound principle, that we must serve the people. As public representatives, this principle must continue to guide our work, our oversight responsibilities, and our commitment to improving the lives of our people of Limpopo. Allow me to conclude with the inspiring words of the former president of the ANC Youth League, Comrade Peter Mokaba, that the youth are not the leaders of tomorrow. They are the leaders of today. Let us therefore continue to invest in our people, strengthen our healthcare institutions, empower young healthcare professionals, and build a healthcare system that is equitable, efficient, people-centered, and responsive to the needs of our people. The ANC therefore supports the adoption of the Portfolio Committee on Health second and third quarter performance reports for the 2025-2026 financial year and calls for urgent implementation of the committee's resolutions. I thank you, Madam Speaker.
Thank you very much, Honorable Member, Honorable Nkonyana Siabonga. Will now allow Honorable Moss. Over to you, Honorable Moss. They mustn't waste your time. Thank you so much, Honorable Moss. You're on the floor. Thank you.
Thank you, Honorable Speaker, the Premier, members of the Executive Council, the leaders of opposition parties, members of this House and guests. Honorable Speaker, one of the most concerning issues in these reports is the repeated failure of regional specialized and tertiary hospitals to comply with the 4 critical domains: patient safety, cleanliness, waiting time, and values and attitudes. These are not luxury standards, these are basics of a functioning health system. A patient has the right to be treated in a clean facility, to be treated with dignity, to receive safe care, and not to wait unreasonable hours before receiving any help. The fact that the same concerns appear in both the second and the third quarter report show that this is not an isolated problem. It is persistent, it is systematic, and it requires direct intervention from our department. The same level of urgency is needed when it comes to immunizations. The report raised concerns about the shortage of measles, rubella vaccines and gaps in coverage. Childhood immunizations is one of the most basic responsibility of any health department. The department cannot afford weak planning, poor supply management, or slow responses in this area. Catch-up campaigns must be properly monitored, especially in rural communities where access to healthcare is already difficult. We also must speak honestly about the medico-legal claims and the contingency liabilities. These are not merely legal files sitting in an office. They are warning signs of a deeper problem in our system. They point to negligent, poor clinical care, poor record keeping, and avoidable patient harm. Every rand lost to a medico-legal claim is a rand taken away from clinics, ambulances, medicines, infrastructure, and staff. The department must deal with these claims properly, but more importantly, it must prevent the failures that caused them in the first place. Emergency medical service also remains a serious concern. The reports refer to the shortages of EMS personnel, delays in the accreditation of the EMS college, the need to train the EMS staff, shortages of drivers, and the challenges caused by the 1 crew per ambulance policy. An ambulance that exists on paper but cannot properly respond properly because there is no driver or not enough crew is not a real service to the public. Rural communities especially cannot be left in a position where emergencies care depends on luck. The department must provide a practical plan to address the EMS staffing, training, accreditation, and ambulance availability, because in an emergency, delays cost life. I thank you, Speaker.
Thank you very much. I want to inform the honorable members who are debating that they mustn't think that the MEC has decided to leave. She has apologized, like I've indicated. They are traveling to Mosena as deployed by Executive Council, as led by our own Premier, Dr. Popira Matuba. So Honorable Mawai is going to be responding to the debate on her behalf. We shall now allow the chair of the committee, Honorable Thabo Maboja, when he's making his maiden speech as the chair of the committee.
Honorable Speaker, Honorable Deputy Speaker, Honorable Premier, members of the Executive Council, Deputy Chief Whip, and the Whipari, Deputy Chair of Chairs, honorable members, ladies and gentlemen. We rise in the month of July, a month that carries the moral footsteps of Nelson Rolihlahla Mandela. July is not an ordinary month in the life of our democracy. It is a month that reminds us that service to the people is not a favor, but a duty and not an act of charity. but an obligation imposed by history, by the Constitution, and by the liberation struggle. Mandela Month teaches us that the poor must not be visited only during campaigns, remembered only during speeches, or reduced to statistics in reports. The poor must feel government in the clinic queue, in the hospital ward, in the ambulance response, in the medicine they receive, and in the dignity with which they are treated. Health is therefore not only a departmental program. Health is a human question. It is about whether a mother survives childbirth. It is about whether a child receives immunization. It is about whether the elderly receives medicine without humiliation. It is about whether mental health is taken seriously. It is about whether the people in rural areas can access care without traveling long distances while sick and vulnerable. Honorable Speaker, I rise on behalf of the Portfolio Committee on Health to table the committee reports on the second and third quarter performance reports of the Limpopo Department of Health for 2025-26 financial years. Our constitutional mandate is very clear. We are here to conduct oversight, to monitor performance, and to ensure that the department continues to implement its budget in a manner that improves the life of the people of Limpopo. The committee reports expressly ground this work in terms of Section 114, subsection 2 of the Constitution, and the standing rules and orders of this legislature. Honorable members, the reports before us shows us a department that is working, moving, and correcting. We must acknowledge that the progress without hesitation. The department sustained compliance with the payment of suppliers within 30 days. This is important because when government pays on time, small businesses survive, workers are paid, families are supported, and local economy breathes. The committee also notes progress in the implementation of the Audit Action Plan. The movement from 9 implemented findings in the second quarter to 13 implemented findings in the third quarter shows a department that is responding to oversight and strengthening internal controls. This is what a capable developmental state must do: identify weaknesses, correct them, and improve systems. We further welcome the performance of EMS. EMS remains one of the most visible signs of government in moments of crisis. When an ambulance arrives on time, government arrives with it. When a paramedic responds, the state is no longer an abstract concept. It becomes a hand of help at the point of pain. Honorable Speaker, we must welcome the progress in the availability of essential medicines at depot, hospital and primary health care levels. A clinic without medicine is a promise without fulfillment. A hospital without medicine is a structure without healing power. The sustained availability of medicine must therefore be protected, strengthened, and monitored. However, while we acknowledge progress, we must also speak of areas of concern. A responsible committee does not praise blindly, and it does not criticize recklessly. It appreciates progress while identifying where further work is required. The first area is district health services. This is the front line of healthcare. This is where ordinary citizens meet the public health system. The committee has correctly emphasized the importance of reporting on ideal clinics and clinics operating for 24 hours. We want to make an emphasis that our people don't get sick only during office hours. The department must therefore continue assessing clinics properly whilst declaring them ideal or suitable to operate for 24 hours. The committee specifically recommended that clinics must be assessed for nurses, visiting doctors, essential equipment, infrastructure, and any other requirements before such declarations are made. The second area is the NHI readiness. The ANC-led government has correctly placed universal health coverage at the center of health transformation. But NHI readiness must be supported by credible reporting, functioning facilities, clean hospitals, reliable medicine supply, staff capacity, and effective governance. The committee therefore calls for the proper reporting on NHI activities, but not to attack the department, but to strengthen the road towards a more equal health system. The third area is mental health. July reminds us that health is not only physical. The report shows that the challenges remain in the recording and reporting of PHC mental disorders treatment rate. What is recorded cannot be properly managed. What is not properly managed remains hidden. The department must therefore strengthen training, improve clinical records, ensure that mental health is treated as a serious component of primary health care. Honorable members, the committee also knows the continuing public concern regarding HIV, TB, and treatment adherence. These are not challenges that can be solved by the clinic alone. They require households, communities, traditional leaders, churches, civil society, community health workers, and all spheres of government. Treatment adherence must be supported by education, tracing, counseling, and social mobilization. On maternal and child health, we welcome progress where targets were achieved. However, deliveries amongst children aged 10 to 14 remain deeply troubling. These are children. This is not only a health matter. It is a child protection matter, a policing matter, a social development matter, and a community leadership matter. The department must continue to work with education, social development, SABs, traditional leaders, and civil society to protect our children. The committee also knows the immunization concern, particularly the vaccine shortages affected coverage. We welcome catch-up efforts, but these efforts must be intensified. Immunization is prevention, and prevention is one of the most powerful tools of public health. Infrastructure is another important matter. The committee knows progress on projects such as Ellis Ras Hospital, the Tabaneng Clinic, and hybrid energy installation. But the department must continue to strengthen contractor management, maintenance planning, and project reporting. A hospital must not struggle because infrastructure reporting was unclear. Public health facilities are assets of the people and must be protected as such. Honorable Speaker, the reports also remind us that the importance of disciplined expenditure. The second quarter report notes overall expenditure of 47%, slightly below the 50% norm. While the third quarter report notes 63% expenditure against the 75% norm, with certain programs underspending. From an MBA perspective, this calls for execution discipline. From a legal perspective, it calls for compliance and accountability. From a political perspective, it calls for implementation of the ANC mandate. From a human perspective, it means every rand must move closer to the patient. The ANC-led government does not plead guilty to hopelessness. It places before the House evidence of progress, admits areas requiring improvement, and commits to corrective action. The people do not recover from political objections. Clinics are not built by applause lines. Ambulances do not move because of press statements. They move because government plans, budget, staffs, procures, monitors, and implement. Our case is simple. Where there is progress, sustain it. Where there is weakness, correct it. And where there is public concern, respond with action. That is the mandate. This is evidence that the ANC is at work. Honorable members, these reports must not become sleeping documents. Let them walk in clinics. Let them breathe in corridors. Let them move with ambulances on the road. Let them speak to medicine depot, nursing colleges, infrastructure side. In this Mandela month, as I conclude, the health of our people is still in our hands. The dignity of the poor is still in our hands. The 24-hour clinic is still in our hands. The clean hospital is still in our hands. The reliable ambulance is still in our hands. The medicine shelf, the caring nurse, the trained doctor, the protected child, and rural patient are still in our hands. On behalf of the Portfolio of Health, I hereby move for the reports of the Portfolio Committee on Health on second and third quarter reports of the Limpopo Department of Health to be considered and adopted by this Honorable House. I so move. Thank you very much.
Thank you very much, Raleboga, the maiden speech. I would not even stop you today because that was the maiden speech. I want to indicate that, Honorable Mawa, you will not respond now. will allow members to take the next debate on the oversight of health, so that when you respond, you can respond on the two debates at the same time. So we shall now move. Chairperson, I made a mistake that you have gone to sit down. You're supposed to sit here next to me, and so that you can now proceed to move the other reports. We are now at 7.2, consideration and adoption of the following reports of the Portfolio Committee of Health, Committee Chairperson, Honorable Mabucha. 7.2.1, report on the unannounced visit to the Lokong Hospital in the Sekhukhune District, 14 August 2025. Over to you, Chair.
Thank you very much, Madam Speaker. Madam Speaker, I move that this House considers and adopts the following reports. The first one is the report on the unannounced visit to the Lokong Hospital in Sekhukhune District on the 14th of August, 2025. Thank you.
Thank you. Seconder, Honorable Rakwali.
Thank you, Honorable Speaker. I stand to support or to second the presentation is made by Honorable Chair of the Department of Health. Thank you.
Over to you, Honorable Chair. 7.2.2.
Thank you very much, Speaker. Speaker, I move that this House considers and adopt the report on the unannounced site visit to Philadelphia Hospital in the Sekhukhune District on the 15th of August, 2025. I so move.
Seconder, Honorable Metara Motlhole.
Thanks very much, Dr. Speaker. I therefore stand to move for the adoption, to second the adoption of the presentation as made by the chairperson of the health. Thanks.
Thank you very much. Over to you, Chair. 7.2.3.
Thank you very much, Speaker. Speaker, I move that this House considers and adopt the report on the workshop with various stakeholders at the Ranch Hotel on the 3rd of September, 2025. I so move.
Any seconder, Honorable Spuru.
Thank you, Honorable Speaker. I stand to support the move by the committee chair, the brand new chair, the man of the moment. Thanks, Honorable Speaker.
Thank you, Chairperson. 7.2.4.
Thank you very much, Speaker. Speaker, I move that this House considers and adopts the report on the unannounced site visit to Elim Hospital in the Vembe District on the 8th of October, 2025. I so move.
Any seconder, Honorable Mtaka.
Nakensa manana speakera nirifalaza Filimon Mdaka ni mele kusekretary sibosho ke mhlonipeki bona tatana Mabucha aka report leyi va yi vulavulaka ke yona ya ku vhakachela xibedhlele xa Elim Hospital laha ku nga hlanganiwa ni vatirhi va ndhawu liya hi siku na siku leriya. Thank you.
Councillor, over to you, Chair. 7.2.5.
Thank you, Speaker. Speaker, I move that this House considers and adopts the report on the unannounced site visit to Skororo Hospital in the Mopani District on the 7th of October, 2025. I so move.
Thank you very much, Honorable Rachweni.
No, thanks very much, Honorable Speaker. Nakieme mo second seboledi se sa tlo bolela mo chairperson o moswa wa khoro ya maphelo mo province ya Limpopo re re tšeo di boletse mogalabe re a di second ke a leboga.
Re a leboga, Honorable MEC. We shall now move to the next item, 7.2.6, Honorable Chair.
Thank you, Speaker. Speaker, I move that this House considers and adopt the report on the unannounced site visit to Dr. C.N. Padudu Hospital in the Mopani District on the 7th of October, 2025 as a report of this House. I so move.
Thank you, Honorable Moss.
Thank you, Honorable Chair. I can move to second the report as presented by the Honorable Chair.
Thank you very much, honorable members. We shall now refer to the speakers list. In terms of the speakers list, Honorable Nkonyana, are you still opening the debate? Over to you, Honorable Abednego Bongani Nkonyana.
You may sit down, all of you. Speaker, the chairperson loves me, the new chairperson, in fact. Thanks very much, Madam Speaker. Let me this time rise on the protocol already established, but specifically and especially greet the Deputy Chair of Chairs, which I omitted earlier. Thanks very much, Honorable Speaker. Speaker, I rise today to present a consolidated report on the unannounced oversight visits conducted by the Portfolio Committee on Health at Skororo Hospital, Dr. Sien Paturi Hospital, Philadelphia, Dilokong, Elim hospitals. Speaker, these visits were not merely administrative exercises. They formed part of our responsibility as public servants to assess whether the institutions of democratic state are responding to the needs of the people, particularly the poor, the unemployed, women, the elderly, and the general rural communities who rely almost entirely on public healthcare services. Madam Speaker, the struggle for accessible and quality healthcare service is inseparable from the broader struggle for social and economic transformation. More than 3 decades into democracy, many of our people continue to experience the effects of apartheid special planning. Underdevelopment and inequality still haunt our communities. These realities place immense pressure on public health institutions, especially those serving rural and historically disadvantaged communities. The democratic state has a responsibility to ensure that every citizen, regardless of class, income, and geographical location, has access to quality healthcare services. Madam Speaker, our hospitals exist to serve the people. Those that I mentioned above. At Skororo Hospital, we observed both commendable efforts and serious challenges. The institution serves a large rural population under difficult conditions. And despite these challenges, workers continue to serve our community with commitment and dedication. However, the infrastructure challenges, prolonged waiting times, and shortages of critical resources remain serious obstacles to quality healthcare delivery. These challenges require urgent intervention and investment. Rural communities cannot continue to receive services that are inferior to those that are available in urban centers. The principle of equity demands that resources should follow where they are needed. Madam Speaker, furthermore, at Dr. Sien Paturi Hospital, we have noted improvements in patient management systems and, of course, the coordination of our staff. These improvements demonstrate what is possible when management and workers are united around a common objective. However, still, overcrowding, staff shortages, and infrastructure constraints continue to place enormous pressure on the institution. The growing demand for healthcare services must be matched by increased capacity, strategic planning, and adequate resource allocation. Madam Speaker, at Elim Hospital, we found an institution carrying a significant burden because it serves as a referral center for many surrounding communities. Management has introduced measures aimed at improving efficiency, but the demand for service continues to exceed what we have. The hospital requires infrastructure expansion, strengthened procurement systems, and additional healthcare personnel. Without these interventions, the institution will continue to struggle to meet healthcare needs of the people. Across all institutions visited, One reality became abundantly clear. The backbone of our public healthcare system remains the workers, the nurses, doctors, emergency personnel, pharmacists, cleaners, porters, administrators, and support staff. They all continue to carry the healthcare system on their shoulders despite very, very and extremely difficult working conditions. Their dedication must be recognized and supported, Acting MEC. No healthcare system can succeed when workers are overburdened and understaffed. Madam Speaker, lastly, we took a tour to Philadelphia Hospital in Tunnelton. Witnessed many concerns there. Challenges include weaknesses in OPD filing system, staff shortages across departments, the incomplete laundry project, poor standards of hygiene in certain areas, and concerns regarding staff attitude. We must be frank. A public institution cannot fulfill its mandate if there is a disconnect between leadership and frontline workers. Equally, public service requires discipline, accountability, and commitment. Every public servant has a responsibility to treat patients with dignity and respect. The people who enter hospitals are not merely statistics. They are human beings, members of our communities, and the very people whose taxes sustain this democratic state. Honorable Speaker, our oversight visits have all reaffirmed an urgent need for one, accelerated infrastructure maintenance and development projects, increased staffing levels, efficient and transparent procurement, improved availability of medicines, equipment, and essential supplies, enhanced patient management systems, stronger accountability mechanisms throughout the whole sector. Madam Speaker, the NDR calls upon us to build a developmental state that places the needs of our people above all. Healthcare institutions must become centers of excellence, social justice, equality, and human dignity. We cannot allow working class communities and rural poor to bear the burden of weak administration, inadequate infrastructure, or poor planning. The democratic state must intervene decisively where failures are identified. Our people deserve a healthcare system that is efficient, accessible, responsible, responsive, and accountable. They deserve hospitals that restore hope, that preserve dignity, that protect life. Our masses must remain our real heroes. It is our communities who experience these challenges daily. It is our workers who continue to carry the burden of service delivery under very, very difficult conditions. It is therefore our duty to listen to our people. The voices of patients, nurses, doctors, cleaners, and community members must remain at the center of our interventions as government. In conclusion, let us strengthen our commitment to building a healthcare system that truly serves the people. Let us honor the sacrifices our workers have made. Let us continue advancing the struggle for society founded on equality, solidarity, and human dignity. Together, we can build healthcare institutions that reflect values of our liberation movement and the aspirations of the people of Limpopo. As MPLs, we carry responsibility to ensure that every hospital, every clinic, and institution in our province becomes a beacon of hope, a beacon of dignity and quality service to our people. Let us act with agency. Let us act with discipline. Above all, let us act in the interest of the masses who have elected us to come here and govern. The people of Limpopo deserve nothing less. Forward with public quality health care, forward.
Ra leboga, siyabonga. We'll request Honorable Moss, you are the next honorable member on the debate. Yeah.
Thank you, Honorable Speaker. We rise today to debate reports that claim to provide oversight through unannounced site visits to public hospitals. The basic promise of oversight is accountability that leads to improvement, not merely documentation of problems that hospitals and communities already know too well. The reports on Dilokong, Philadelphia and Elam hospitals and Sekororo Hospital present serious and recurring failures across staffing, infrastructure, equipment maintenance, service readiness and governance. What is most disturbing is not that the challenges exist, but that the same patterns reappear across different facilities as if the system cannot learn from its own faults and findings. These reports repeatedly described hospitals operating below capacity while communities carry the consequences through long waiting times, reduced access to specialists, and delay emergency care. Dilokong and Philadelphia illustrate how understaffing is not a minor administrative problem, but a direct threat to patient safety. When there are too few doctors for casualty and night shift, when staff are forced to multitask beyond their job description, and when vacancies are filled through acting positions or temporary labor, patients do not receive care as per policy, they receive improvisation. In emergency medicine becomes a risk factor. These reports themselves show that emergency response and observation times are compromised, including cases involving maternal deaths and delays related to transfer and ambulance logistics. A second pattern is equipment and technology breakdown. The reports describes critical diagnostics and life support related equipment that is missing, non-functional or broken again shortly after repair. Where services are cancelled because an ECG or a CR machine is unavailable, the department is not simply facing maintenance challenge, it is failing to ensure the minimum operational readiness of a hospital. The Philadelphia report further shows technology reallocated to other hospitals because infrastructure cannot support it, meaning that procurement decisions were disconnected from real capacity. This is wasteful and breeds public distrust because communities see money spent without tangible results. Let it be clear, the issue is not that hospital faces challenges. The issue is that government allows preventable failures to become normal. If oversight is meant to ensure delivery of policy and authorized goals, then the repeated recurrence of these same problems across multiple facilities is an indictment of how delivery is managed. For that reason, the opposition submits that the reports must not be adopted if they are at the end of the accountability. They must be the beginning of consequences. I thank you.
Thank you very much. We'll now request the chair to come and close the debate.
Thank you very much, Speaker. Honorable Speaker, Honorable Premier, allow me to write on the protocols already observed. I rise as the newly appointed chairperson of the Committee of Health to table before this Honorable House the oversight reports of the Committee for consideration and adoption. Honorable Speakers, these reports are not merely pages bound together by parliamentary compliance. They are a story of our public health system as seen from the ground. They are a story of hospitals that continue to serve, workers who continue to give, patients who continue to hope, and a government that must continue to improve. The story begins not in this chamber, but at an entrance of a public hospital. A patient arrives, it may be Dilokong, Philadelphia, CN, Patudi, or Sekororo. The patient does not arrive carrying a policy framework. The patient arrives carrying pain, anxiety, and expectation. From that moment, the public health value chain begins. Access, records, triage, clinical assessment, diagnostics, treatment, medicine, admission, referral, or discharge. Honorable members, the patient journey is a value chain. If one link is weak, the whole experience is affected. If a file cannot be retrieved, waiting time increases. If water is unreliable, infection control is compromised. If posts remain vacant, the burden falls on those who are already working. That is why the committee undertook unannounced oversight visits. We wanted to observe the system as it operates in real life. We went beyond prepared presentations. We went into wards, kitchens, pharmacies, maternity wards, mortuaries, and support service areas. We engaged managers, patients, staff, and observed service delivery conditions directly. Honorable Speaker, the picture emerging from this report is balanced. It is not a story of collapse. It is a story of a health system under pressure, but still saving. It is a story of institution facing constraints, yet continue to provide care. It is a story about public servants who, despite shortages and old infrastructure, remain committed to our people. At Ilokong Hospital, we saw a large district hospital that continued to serve as an important referral point in Sikukuni. It continues to render district health services and elective operations to reduce backlogs. We noted medicine availability at 88% at the time of the visit, which is a positive foundation to build on. However, we observed staff shortages, high vacancy rates, acting positions, nursing accommodation challenges, and support services. At Philadelphia, we saw a regional hospital with a proud history of serving our people. It provides a wide range of services, including surgery, internal medicine, obs and gyn, pediatrics, psychiatry, dental care, and outreach support. The Gateway Clinic attached to the hospital is a positive intervention because it helps to ease the pressure on OPD. The committee also observed an old infrastructure, shortage of specialists, absence of high care unit, manual recording management, and EMS delays. At Dr. C.N. Patud, we saw a facility that remains important to the communities it serves. It has a functioning theater and continues to provide essential clinical services. But through the lens of theory of constraints, we identified bottlenecks, such as vacancies, acting management positions, water shortages, electricity interruptions, and pest control concerns. At Elim Hospital, we saw one of the oldest and most historic hospitals in our province. It has served generations of people, some amongst us here, including members of this house, such as the Premier and Honorable Mdak. It continues to do important clinical work, including cataract surgeries through collaboration with Rural Health Matters. That is a positive story of resilience and partnership. At Sikororo Hospital, we saw a rural hospital that continues to carry the responsibility of serving communities in the Maruleng area, Abonkakare. The presence of a gateway clinic within the hospital premises is positive, and the fact that several referring clinics have achieved local ideal clinics show that there is progress. But however, challenges still remains. Honorable Speaker, when one applies systems thinking, the lesson is clear. A hospital is not just a building, it's an ecosystem. It depends on clinics, EMS, municipalities, ESCOM, water authorities, and so on. Because if one part of that ecosystem fails, the patient will feel it. That is why the committee also convened a workshop with key stakeholders, such as HPCSA, Chair, Limpopo College of Nursing, Limpopo College of Emergency Care, and SANC. The workshop dealt with the future health workforce of our province. We cannot complain about shortages tomorrow if we do not train enough nurses, emergency medical care practitioners, and specialists today. Training institutions must be properly accredited, properly resourced, and properly supported. Using the balanced scorecard, these reports speak to 4 areas. First, the patient perspective, waiting times, dignity, privacy, safety, cleanliness, and access to care. Secondly, internal process perspective, records management, EMS response, equipment maintenance, infrastructure turnaround times. Thirdly, the learning and growth perspective, which deals with the training, accreditation, ICT infrastructure, EMS training, and professional development. Fourthly, the stewardship perspectives, Public money must produce public value. Honorable Speaker, our approach as the Portfolio Committee is constructive. We do not present these reports to weaken the department. We present them to strengthen service delivery. Oversight is not hostility. Oversight is a constitutional accountability. It is how the legislature assists the executive to move from policy to implementation, from plans to results, from budgets to impact. Honorable Premier and Honorable MEC, the committee acknowledges the work being done by the department and dedication of the frontline health workers across the province. We also appreciate that many of these challenges are historic and systematic, but our people do not experience history as an excuse. They experience it as a queue, as a broken machine, as a delayed ambulance, as a missing file. Therefore, our responsibility is to turn systematic challenges into systematic solutions. Honorable members, the ANC-led government understands that healthcare is not a favor, it is a constitutional duty, a moral obligation. A trauma patient does not make an appointment with an accident. In conclusion, Speaker, these reports are not a story of despair. They are a story of a health system that is still standing, still serving, still healing, but asking us to govern better, plan better, train better, and execute better. These reports must not be treated as political ammunition, but as a performance dashboard for service delivery. It is easy to stand at the end of the value chain and point at the patient queue. The people of Limpopo do not need applause for complaints. They need disciplined executions. They do not need leaders who celebrate weakness for headlines. They need leaders who convert findings into solutions. So let us compete, if we must, not on who shouts the loudest, but on who helps the health system move from pressure to performance, from diagnosis to treatment, from oversight to measurable improvement. Honorable Speaker, a hospital is where the state meets the most vulnerable citizen. It is where policy must become compassion. It is where budget must become medicine. It is where oversight must become dignity. On behalf of the Portfolio Committee on Health, I recommend that this House considers and adopt this report. I thank you.
Thank you, Chairperson Raleboga. We shall now call upon the Honorable, the MEC for Treasury, Honorable Mawai, to come and debate to respond on behalf of the MEC of Health, Honorable Mashego. Honorable Mawai, over to you.
Thank you, Madam Speaker. I come once again to represent, but that's no excuse. We are encouraged. That is where oversight meets accountability. The spirit with which the committee has approached, especially the visits for oversight, is clearly exactly what is intended in our constitution, in our policy. Let it be remembered that the ANC has a health policy dating as far back before this democracy, which emphasizes primary health care. And therefore, your advice on district hospital work cannot be overemphasized. It's as true as what the NC government is intending to do. You see, your balanced score approach is exactly advisory and very insightful. Actually, oversight is about giving evidence from a different perspective to the user. And in this case, the Department of Health is listening with 2 ears. As some of these things, of course, after the visit, because the visits date as far back as August 2025 have already been attended to. But the encouragement is that still, once more, the department is working very hard to ensure that all what is being raised in the oversight is being done. I can give, maybe take advantage that through the Premier and the Executive, we have prioritized the funding for maintenance and staff accommodation, including the filling of very critical posts. That is happening, that is still happening, and I believe sooner rather than later, the fruits of this intervention will ripen for eating. And that's, we say, one day, when we come back to this podium, or when the MEC comes back, you'll get a clearer, better report that indicates that everything, especially those things that the Honorable Committee has paid attention to and was very specific about. So there is nothing here that can be argued against, of course, but there are those I should really clearly indicate that, you know, at the time of your visit, of course, the situation was as it was, but later after that, it also assisted the department to ensure that what was raised is being attended to. I can report, based on the information at my disposal now, that, for example, on equipment transferred from Philadelphia that was referred to here, it was as a result of of water, and the equipment therefore to be relocated to Donald Fraser Hospital. So, as we speak, the Gateway Clinic has been refurbished in the previous financial year. And as of now, the department has backup generators as a way to address some of the outages. With these few words, honorable members, I would like to once again appreciate the efforts, the oversight efforts of the committee, the spirit of that the committee has in ensuring that indeed it is not a political instrument to bid or to do something, but it is an oversight report that is saying you can do better. We appreciate the fact that you acknowledge the fact that work is being done. The improvements you are recommending will obviously be done, and in this way, we believe that we will definitely meet all the obligations under the NHI dispensation, and therefore, we want to thank you once again, and thank you everyone who has contributed to this insightful oversight reports. I thank you very much.
Thank you very much, Honorable MEC Mawai. We shall now continue, honorable members. We shall call upon the chairperson of Committee of Portfolio of Sports, Arts and Culture, Honorable Mudaka, to come and move for the adoptions of the reports.
Na khensa manana Deputy Speaker. Ni xeweta nhlengeletano hinkwayo, ni xeweta mupremier wa hina na ti-member ta executive leti nga kona haleni ka siku ra namuntlha na n'wina ti-honorable members hinkwenu. Mina Falaza Philemon Mudaka, la tivekaka ngopfu vito ra Indion le kaya le. Ni yimela ku susumeta leswaku report ya committee ya Department ya Sports, Arts and Culture ya 2025-26 second quarter yi sekreteriwa, yi vulavuriwa hi ndlela leyi, yi tlhela yi sekreteriwa. Okay.
Thank you very much, Honorable Chair. We shall now call upon the seconder. Honorable Christina Mohale.
Thank you, Honorable Deputy Speaker. I second the report as presented by the Chairperson, Honorable Mudaka.
Thank you very much, Honorable Mohale. Over to you, Chair.
Na khensa manana Deputy Speaker nakambe. Tani Falaza Philemon Mudaka ni yimela ku susumeta leswaku ri yindlu leyo hlonipheka swonghasi yi bula hi report ya kotara ya vunharhu ya lembe magidimbirhi na makume mbirhi ntlhanu na magidimbirhi na makume mbirhi ntsevu ya Department ya swa mitlangu, vutshila na ndhavuko. No khensa Honorable Deputy Speaker.
Khensile Chairperson, ai kombela va ri mini Chanda voko ra ku seketela Chairperson. Manana kima okay se ba imisile tso kuno ka re Honorable Khatshelo, thank you very much.
Ndiko u livhuwa thusa mulanga dzulo ndo ima hafha u khwaṱhisedza ripoto ye ya ṋekedzwa nga mudzulatshidulo wa committee ya sports, arts and culture. Ndo livhuwa.
Ro livhuwa vo Honorable Khatshelo, Chairperson wa portfolio ya Public Works. We shall now move, honorable members, to the debates. I shall now call upon the Honorable Bonenguda Doelani Alton to come and open the debate.
Ka mulanga dzulo wa buthano la vhusima milayo la vundu lashu la Limpopo, Mulisei wa Dokotela Makurumpetse, ndi lumelise mulanga vundu lashu la Manakanaka la Limpopo, Bo Dokotela Phophi Ramathuba Machelo, to the Honorable Chief Whip in absentia, to our Honorable Deputy Chief Whip and the Whippery, members of the Executive Council, Chairperson of the Portfolio Committees, all honorable members of the Provincial Legislature, distinguished guests, ladies and gentlemen, the Macheloni will say what? Madam Speaker, the African National Congress has always recognized the importance of sport, arts and culture in building a united, non-racial, non-sexist, democratic and prosperous society. This vision is rooted in the Freedom Charter, which proclaims that all national groups shall have equal rights, and that the doors of learning and culture shall be opened. This is what we are experiencing now. These principles affirm that every South African, regardless of race, gender, disability, or geographical location, deserves equal opportunities to participate in sport, arts, and culture. Madam Deputy Speaker, the African National Congress Manifesto commits to investing in grassroots sports, strengthening school sport, developing community sporting facilities, and identifying and nurturing young talent. These commitments are intended to ensure that no child is denied the opportunity to realize their sporting potential because of poverty or where they live. Madam Deputy Speaker, it is an honor to rise in this august house to present that under administration program, during Q2 report, the program successfully achieved most of its planned performance targets and demonstrated strong levels of compliance, effective corporate governance, and a commitment towards employee wellness and empowerment. Several important initiatives were implemented during the reporting period. As the African National Congress, we really appreciate the progress. This included GBVF awareness session held on the 21st of August 2025, which was attended by 103 employees, the majority being women and youth. On the 22nd of September 2025, the department hosted a women's empowerment session during the SMS meeting, which brought together 22 employees, including persons with disabilities, to engage on matters of gender equality, leadership, and empowerment. Madam Deputy Speaker, furthermore, a men's engagement meeting was convened on the 29th of September 2025, attended by 84 employees, including male youth and persons with disabilities. The session focused on promoting positive masculinity, employee well-being, cultural heritage, awareness, and responsible behavior within the workplace and family environment. No major performance deviations were reported under this program during the quarter. Madam Deputy Speaker, Cultural Affairs delivered several key activities during Q2, particularly through the Arts and Culture sub-program. The program facilitated numerous community conversations and dialogues held in schools, community halls, clinics, art centers, traditional councils, and other public spaces. These engagements contributed significantly towards strengthening social cohesion, cultural expression, and community participation across all districts. The program also successfully transferred 1.2 million rands to the Library for the Blind to support inclusive access to information for visually impaired citizens. As the African National Congress, we welcome and appreciate the work being done by the department in advancing access to information, promoting inclusion, and ensuring that no citizen is left behind. As Sidney Sheldon once said, I quote, "Libraries store the energy that fuels the imagination. They open up windows to the world and inspire us to explore and achieve," I close quote. Madam Deputy Speaker, as the committee, we noted that support to the Limpopo Provincial Language Committee could not be implemented due to an ongoing audit assessment and outstanding compliance documentation, resulting in delays in language development initiatives, as also the appointment of 31 EPWP workers was not finalized during the quarter, affecting labor support for cultural programs. As the African National Congress, we appreciate that the department achieved all its planned targets during the quarter under review. Valid invoices were paid within 30 days at 100%, while preferential procurement targets were significantly exceeded, with women-owned enterprises at 66.66% and youth-owned enterprises at 38.87%. A number of skills development and capacity building interventions were implemented, including additional programs initiated in partnership with the Office of the Premier. Employee wellness initiatives and GBVF awareness programs were also successfully conducted. Madam Deputy Speaker, with regard to infrastructure, the committee remains concerned about delays affecting several library infrastructure projects due to contractor inefficiency, electricity supply challenges, and other implementation constraints. These delays negatively impact the construction, upgrading, and completion of library facilities, which are essential for improving access to information and community services. Madam Deputy Speaker, the committee noted that the Library and Archive Services Program continue to experience procurement and infrastructure challenges, particularly the failure to procure targeted library materials and delays in the implementation of library infrastructure projects. Madam Deputy Speaker, in conclusion, as the African National Congress-led government, we remain committed to transforming the sporting landscape, ensuring equitable access to facilities, supporting athletes, promoting women's sport, advancing sport for persons with disabilities, and using sport as a catalyst for inclusive economic growth and national development. Together, we must continue investing in sport, because when we invest in sport, we invest in healthier communities, empowering young people, and a stronger, more united South Africa. One Billie Jean King once said, "Champions keep playing until they get it right." We welcome the reports as presented. Rearibua, Bahulise, Akensa, Bakulukumba. Thank you so much, honorable members.
Rolivhuwa bo honorable Vonenguda. Ri khou bvela phanḓa zwa zwino ri khou humbela the chairperson of the portfolio committee ya sports arts and culture to come and close the debate.
Thank you, Madam Speaker, and greetings once more. In sport, when you go to a game and you find that the opposing team is not there, it's a walkover. And I'm not surprised that we are actually warm-upping alone in the field, myself and Honorable Nenguda. We're warm-upping, looking at our watch and looking at the other team, whether they are coming or not coming. And it's very clear that the team is not there. They've abandoned their work. So we are going to get all the points at the African National Congress. And we're very happy that indeed we will stay at the top, as the ANC is always at the top, and we're no more going to give them a chance to gain, some points in terms of how we're playing here. So this debate is about us, it's about what we do, and what we do is about our people. So I'm not going to really worry much, because I know that you have given me enough time. The time was supposed to be 90 minutes, but when it's a walkover, you don't play for the whole 90 minutes. So we're just going to take the points and go away. Madam Speaker, it is an honor to rise on behalf of the African National Congress to debate the 2025-2026 second and third quarter reports during the birth date month of our founding democratic president, Nelson Rolihlahla Mandela. This month gives us an opportunity to reflect on the extraordinary life of a man who dedicated his life to the struggle for freedom, justice, equality, and human dignity. But also, it is time for self-introspection of our role to contribute further towards achieving his vision of a non-racial, united, and prosperous South Africa. Nelson Mandela's unwavering commitment to reconciliation and nation building laid the foundation for a democratic South Africa we all enjoy today. People can speak. There is freedom of speech. Anyone can say anything. Even those that have got no solution, they want to say they have the solution. But I want to remind everyone that is the African National Congress, under the leadership of our president, our sitting president, that has the solution for the challenges that we have as a nation. We have a plan that has always been there, the Freedom Charter, that guides us at all times. Madam Speaker, President Nelson Mandela's passion for sports, arts, and culture demonstrated during the 1995 Rugby World Cup, where Mandela showed the world that sport could become a powerful symbol of reconciliation and national unity. We dare not fail President Mandela. It is time indeed to look at what is happening today whether we are actually all of us contributing towards making sure that we are an organization, we are a country that is working together. As we honor his legacy, we must ask ourselves whether we are living according to the values he cherished, which is respect, compassion, self-service, selfless service, accountability, and justice. This ways does not need emphasis. Anyone who does not respect, no one would respect them. So there's a need for us to interact properly when we're at work, wherever we are, whether you are at home, wherever you are. Even in the Bible, respect is always mentioned. That you need to respect your parents for you to be able to live a proper life. Madam Speaker, as Mandela once said, it is in your hands to create a better world for all who live in it. Close quote. Let these words inspire us to work together to eradicate poverty, create opportunities for our youth, for our young people, strengthen social cohesion, and build a South Africa that reflects the dreams and sacrifices of those who fought for our freedom. People died for this freedom. People lost their lives. They gave everything they had for us to be where we are today. So as we commemorate Nelson Mandela's birthday month, let us recommit ourselves to his vision of a united, non-racial, non-sexist, democratic, and prosperous South Africa. It is not time for divisions. It is not time to fight other people. It's not time for humiliating others, whether they are from inside our country or from outside our borders, because we are all but Africans. Madam Speaker, Program 2, Cultural Affairs, experienced the largest budget reduction as a result of continuing underspending since the first quarter. Obviously, in the first quarter, we don't expect much, but we don't believe indeed, as we are saying, that the sport is not necessarily, the Department of Sport is actually doing better. We know that the money went down because of the theater there, because it couldn't be implemented in terms of the timelines. But by the end of the third quarter, we saw the department spend 521,753 million rand, representing 69% of its adjusted budget. This is, again, below the expected benchmark. Of course, it is the third quarter. We are aware that by the final quarter, most of the monies were spent. Madam Speaker, as I said that I don't want to say much. We have said a lot in our last debate. We want the Department of Sport, of Arts and Culture to be given more money. We know that there is going to be a response in the next, maybe even during the time when we relook into our budget. We hope that something will gonna come. You have seen what Bafana has done for us as a country. We are very proud. And all these things is because of the contributions that are there within our departments to take all our young people off the beer halls and so on. Madam Speaker, I can see that it is time for me to go and sit down. And I want to conclude by saying that let's continue working together as a committee, even if we are by ourselves, even when the opposition is not there. Of course, we don't expect a lot from the opposition. We will always be here in big numbers to make sure that we represent our people properly in this house and make sure that we do what we're supposed to do and not fail them. Of course, today people are talking a lot. As we said earlier on, everybody thinks there is something that they can say because we fought for this freedom of speech and we're not going to gag anyone. We want people to say whatever, we want people to be free. But freedom also comes with responsibility. You are not going to then wake up every day and speak on the radio and talk things that are not really assisting us or assisting the country. So in these few words, I want to move that the report, second quarter report and third quarter report of the Department of Sports, Arts and Culture be adopted by this honorable house, and that the African National Congress honorable members are at work we're going to continue doing that. And you must look upon the ANC all the time and make sure that you vote ANC so that we can do what we're supposed to do. I thank you, honorable members.
Thank you very much. Chairperson, don't go. We shall proceed. You then call for the adoption of the reports. MEC will come once all the debates are done. Over to you, Chair.
Thank you very much, Honorable. I don't know if I'm a man of the moment, because the man of the moment is Honorable Mawucha. But I think we're together in this. Honorable Deputy Speaker, thank you once more. I, Falaza Philemon Mdaka, rise to move for considering an adoption the oversight report, visit to Member District, Chauli Library, Sasalaman Library, and Mulamla Library. I so move, Honorable Deputy Speaker.
Thank you very much, Honorable Chair. Call upon the seconder now. Honorable Mihloti Mhlope.
Thank you very much, Honorable Speaker. I rise to second the report as presented by the chairperson.
Thank you very much, Honorable Mhlope. We shall now over to you, Chair.
Thank you, Honorable Deputy Speaker. I, Falaza Philemon Mdaka, once more move that the report on oversight visit to Capricorn District, Limpopo Archives, Limpopo Sports Academy, and Limpopo Provincial Theatre be considered by this Honorable House. I so move, Honorable Speaker, Deputy Speaker.
Thank you very much, Honorable Chair. Seconder, Honorable Machomane.
Thank you very much, Honorable Deputy Speaker, for the opportunity. I rise to second the report as presented by the Chairperson of Sports, Art and Culture. Thank you very much.
Thank you very much, Honorable Machomane. Over to you, Chair.
Thank you, Honorable Deputy Speaker, once more. I, Falaza Philemon Mdaka, hereby present the report on oversight visit to Skukuna District, Jate Heritage Site, Agent First Library. I so move, Honorable Speaker, Deputy Speaker.
Thank you very much, Honorable Chair. Seconder, Honorable Mapula Mkaba.
Thank you, Honorable Deputy Speaker. I rise to support the report that presented by Honorable Mutaka. Thank you very much.
Thank you very much, Honorable Mukaba. Over to you, Chair.
Thank you, Honorable Deputy Speaker. I, Falaza Philemon Mdaka, hereby present the report on oversight visit to allegations regarding logistic challenges experienced during school participation at the National School Sports Championship Athletes April 2025. It is not an oversight, it's an oversight, it's not an oversight visit, it's an oversight to allegations regarding logistic challenges experienced during school participation and the National School Sports Championship Athletics April 2025. I so move, Honorable Deputy Speaker.
Thank you, Chair. Seconder, Honorable Matsuban. Okay, my apologies to you, Chair.
Well, thank you very much, Madam Speaker. I rise to second the report as presented by Honorable Mdaka.
Thank you, Honorable Matabuke. Over to you, Chair.
Thank you, Honorable Deputy Speaker. I, Falaza Philemon Mdaka, hereby present the report on officers' visit to Palabora Library, Liboneng Community Library, and Limpopo Mutiwabatsonga Open Museum. I so move, Honorable Deputy Speaker.
Thank you, Chair. A seconder, Honorable Pakana Ratweni.
Thanks very much, Honorable DS. I also rise to support or second the report as presented by Honorable Chair, Honorable Mdaka.
Thank you very much. Over to you, Honorable Chair.
Thank you, Deputy Speaker. I, Falaza Philemon Mdaka, present the report on oversight meeting with the Office of the State Attorney. I so move, Honorable Deputy Speaker.
Thank you very much. Seconder. Honorable Percy.
No, thanks very much, Chair. I hereby second the report as presented by the Chair. Thanks very much.
Thank you very much, Honorable. Let's continue, Chair.
Thank you, Honorable Deputy Speaker. I hereby present the report on oversight meeting with the Department of Sports, Arts and Culture statutory body, the Limpopo Sport Confederation.
Thank you very much, Chair. Seconder. Honorable Piedi.
Thank you very much, Honorable Speaker. I rise to second the report presented by Honorable Mdaka. Thanks.
Thank you, Honorable Piedi. Over to you, Chair.
Thank you, Honorable Speaker, and I believe this is the last report, and there will be no extra time. Report on the oversight visit meeting with the Department of Sports, Arts and Culture statutory bodies, Limpopo Heritage Resources Authority, Limpopo Language Board, and Limpopo Arts and Culture. I so move, Honorable Speaker, Deputy Speaker.
Thank you very much, Honorable Chair. A seconder, Honorable Kakarin Christian Rakwale.
Thank you, Honorable Deputy Speaker. I stand to second the presentation by the Chair of Sport, Arts and Culture. Thank you.
Thank you very much, Honorable Rakwale. Honorable members, we shall proceed now and go to the debates. And now we are calling upon the chairperson of Portfolio Committee of Health, who's no longer new now. He's a chairperson who's coming to debate, to open this debate. Today is your day, Chair. May you proceed.
Deputy Speaker, Honorable Premier, Speaker, allow me to write on the protocols observed. Madam Speaker, before I proceed, allow me to salute Bafana Bafana for their historic performance. Their 1-0 victory over South Korea through that Tapelo Maseko, but though not related to Honorable Maseko's goal, secured historic progress to the knockout stage of the FIFA World Cup. That performance reminded us that South African sports has entered a new chapter, capable of competing on the world stage. It is therefore our duty as a province to build the pipeline that will produce the next Bafana Bafana heroes from the villages and townships of our province. Madam Deputy Speaker, the ANC was not sent here by the masses of our people to decorate failure. We are here sent to confront weaknesses, correct the machinery of the state, defend public resources, and make government work for ordinary people in every village, township, and town in Limpopo. Madam Speaker, the people of Limpopo must know that the opposition in this house, when robust, oversight, demand, discipline. Some in the opposition retreat, they take breaks from the battle of ideas. You can see today they are not here. It's only one member from the opposition. They wanted noise, not to debate. Headlines, not substance. Criticism, not accountability. But we are here to do the work. Madam Speaker, reports before us deal with the oversight work in Vembe, Capricorn, Sekukune, and Mopani districts. On paper, this may appear to be separate reports. In truth, they ask one question. Is the state strong enough, disciplined enough, caring enough to deliver dignity to our people. Madam Speaker, the Honorable Premier Dr. Popira Matuba has reminded us that there is no space for corruption, waste or abuse of public resources. She also reminded us that a capable, ethical, and developmental state must plan, measure, correct, and account. This is the spirit in which these reports must be adopted. Sports, arts, and culture must never be treated as soft issues. They are about memory, identity, language, youth development, creativity, discipline, social cohesion, and dignity. In Vembe, the committee visited Chaulu, Sasamelani, Mulamula libraries. These libraries must not be rural ornaments. They must be working centers of knowledge. A child in Chaulu must not be punished because she was born far from urban center. A learner in Sasamelani must not study under poor conditions while we speak beautiful about youth empowerment. A community in Mlamula must not be given a library in name only. These facilities must be maintained, staffed, resourced, and open in a manner that responds to the realities of our people. In Sikukune, the oversight visit to Tshate Heritage Site, Jane First Library, reminded us that the heritage is not nostalgia. Heritage is political memory. It teaches our children that they come from a people with history, civilization, leadership, and culture. Tshate must therefore be protected and developed, not only as a heritage site, but as a tourism, education, and local economic development asset. In Palabora, the Palabora, Leboneng Community Libraries, and Limpopo Moti wa Batsonga Open Air Museum remind us that cultures live amongst our people. The Moti wa Batsonga Open Air Museum preserves this history, heritage, and cultural identity of the Batsonga and Tsonga Shangaan communities. Such institutions must not survive on speeches and sentiments. Deputy Speaker, I also want to address the Limpopo Sports Academy. Limpopo is not poor in talent. Limpopo is a breeding ground for athletes. Our village schools and township produce raw sporting excellence every year. But the painful truth is that after matric, many of the best athletes are recruited by other provinces because Limpopo does not have a strong enough sports education, bursary, and retention pipeline linked to the academy. Where opportunities exist, they are too limited, poorly funded, and not sufficiently coordinated. The result is that our athletes are discovered here, trained here, celebrated here, and then harvest elsewhere. They leave the province, they build careers elsewhere, and slowly lose their homegrown Limpopo identity. That must change. The Limpopo Sports Academy must not operate like a ceremonial facility with weak financial muscle. It must become a command center for athlete development. We need bursaries, university partnerships, sports science support, talent tracking, school-to-school academy pathways, and a serious retention strategy. If Limpopo produces you, Limpopo must be able to develop you, educate you, support you, and proudly watch you compete as a product of this province. Otherwise, we will remain a nursery for other provinces while our own academy is left underfunded. Deputy Speaker, the report on logistical challenges during National Sports Championship must also be addressed without diplomatic language. When young people represent Limpopo, government must never send them into embarrassment. Transport, accommodation, food, medical support, supervision are not luxuries. They are basic requirements of competent administration. No learner must wear the colors of Limpopo while feeling abandoned by Limpopo. That must never happen. If there was poor coordination, someone must account. Young athletes must not become victims of administrative weaknesses. Madam Deputy Speaker, I now turn to the office of the State Attorney. I do so not only as the member of this House, but also as an admitted attorney of the High Court. The State Attorney is not a courier service for government files. It is an attorney of record for the state. It must advise properly, protect deadlines, observe court rules, communicate with client department, defend matters competently, prosecute recovery claim decisively, and protect the public purse. But the office itself acknowledges a serious capacity crisis. It has one head of office, 7 attorneys, and limited support staff carrying approximately 1.8 files per person. That is not ordinary workload, pressure. It is institutional overload. The office also acknowledged that high staff turnover, recruitment delays, inadequate supervision, rising litigation volumes, and dependence on outsourcing, which is expensive and unsustainable. The Davido Vibe Zone matter proves that danger. The department seeks to recover 1.2 million arising from the alleged failure to secure the video for Mapungube Festival. Yet the matter dates back to 2018. But we know that under the Prescription Act, ordinary deaths generally prescribe after 3 years, unless prescription is legally interrupted. But interruption is not a license to sleep. Litigation must be driven to finality. Madam Speaker, statutory bodies such as LIHRA, the Limpopo Language Board, and Limpopo Arts and Culture existence must be felt by the people. Heritage must be protected, languages must be promoted, artists must be supported, boards must not exist merely to satisfy legislation. They must move the sector forward. The ANC-led government must be judged by impact. Does the learner find a functioning library? Does the athlete find a pathway? Does the museum preserve identity? Does the public money return when contracts are breached? Does the department act with agency when systems fail? Madam Deputy Speaker, these reports must be adopted, but they must not be buried. The department must come back with implementation plans, responsible officials and progress reports. Recommendations must be tracked. Where there's negligence, there must be consequence. Where there's progress, we must support it. In the end, sports, arts and culture are not side issues. They are about the soul of the people. They are about memory, pride, talent, creativity, discipline, and belonging. Let these reports become instrument of action. Let oversight become correction. Let correction become delivery. Let delivery restore trust. I support the consideration and adoption of these reports. Thank you.
Thank you very much, Honorable Mabucha. We shall now call upon the chairperson of the Portfolio Committee of Sports, Arts and Culture to come and close the debate. Honorable Modaka, Philemon. Aza.
Yes, my Indies, that is the man. Thank you very much, Madam Deputy Speaker. I think we have already indicated that there is not much for us to say. I think Honorable Mabucha has actually covered a lot of issues. What is important, Honorable Deputy Speaker, is that definitely we want to see these sporting bodies not being just given R1 million to run all their affairs for the whole year. I think it's not enough. We need to make sure that they are given enough for them to be able to interact with our communities out there. For instance, the sports academies, for instance, we are glad that at least something has been given to make sure that there is something. We are going to build our own, we are going to have our own high performance center in the province. I personally used to go to Pretoria to take athletes in the past and then remain there for a week and for them to be taken there when I was still a bit young. And I'm so happy now that at least that high performance center is definitely going to come to our area because our province have got young people who are definitely talented, and they are the ones that are actually found up there in all the provinces. Even if you can mention our teams that we have, our players are all over the country, and they are produced here in this province. Banyana Manyana started performing because of players from this province. I'm sure you have seen when we won the first CAF match, the goal scorer was from this province. The backliners were from this province, Onukumatlawe and others. Ramalepe, who stayed here, just here in Bendo, is now playing for another team in Gauteng. But she's from right here what is the village name, around the Mujaji. And you can see that she was a man of the match recently here. These players are all from here, and that's what made us now to start playing the way we are playing at the national level. And that can only happen if the Department of Sports, Arts and Culture is indeed interacting with all the sporting bodies, arriving enough to be able to actually do their work. We indicated in our last debate definitely that there's a need for us to indeed support these sporting bodies so that we can reach villages like Mwamankena, where on June 16, I've seen a lot of young people gather there. And there was one young man from the sports academy who was there. And I could see that he was working very hard. The whole community was there. And we need to be visible ourselves, and the department need to be visible to be there. We need to replicate these issues throughout the whole province, where we definitely make sure that there are gatherings of young people, giving them the right things that they are supposed to do, making sure that all sporting bodies are actually, being performed all over. Cricket can never continue to be a sport of certain groups in our country. If we are non-racial, we should also be seen to be non-racial even in sport. Others used to play soccer, they are no more playing soccer. I don't want to mention, because I don't want to appear to be a racist, because we never wanted to be racist in our life. We are non-racial. But then you used to find Indian people playing soccer, good players that we used to see in the past. There are no more, and we need to find a way of supporting, going back to those communities and encouraging them to play. And then when the national team is playing, you find that some of the racial groups are not there. They used to be there before. Where are they now? They are now following certain sporting codes and so on. So we need to definitely deal with these issues by working closely with the sporting bodies to make sure that these issues are actually dealt with decisively, and so on and so on. So, Madam Speaker, I said there will be no extra time. I don't want to waste your time. And I think that we have debated, we have seen that the Committee of Sports, Arts and Culture is hard at work. We are also working very closely with our Honorable MEC, and we are glad in terms of how we're working. We have seen the Honorable MEC recently chairing Bafana Bafana, we're having a helmet on his head. You have seen it on social media. And definitely we want to see those issues continuing as we work and reach out to the poor people out there. I don't want to really take long, except to say that the Honorable Madam Speaker, we are hereby to move for the adoption of all those reports, and we're definitely still going out. We're supposed to be going out even this weekend. We'll be going out next week. We are really checking what the department is doing and making sure that there's value for money in whatever they are doing. And we're happy that they are also continuing to receive clean audits, and they will even receive clean audit, I believe, even this financial year. So, Madam Speaker, with these few words, we want to move that these reports, all of them, be adopted. We will still come back with other reports, and we encourage even the opposition to definitely be here to debate with us. We are not saying that sometimes they are not there. They are there. Sometimes when we go, one or two are there, but others are not there. But all of our members, we're always there. You look at us, we look old, but we're very, 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 very active. Ishichangani or Ishitsonga bare, Samfu rincharitiswa. That's why you see even this debate, you see people like Honorable my Honorable there and Honorable Mabusha there, the man of the moment. Is a young man, but he's being secretary in Alabakulu. So I present so comes as one Yamatreni, and then it relas Chava Shine and I can't go.
Thank you very much, Honorable Chairperson, Honorable Filimoni Falaza Mudaka. He can see. We shall now call upon the MEC of Sports, Arts and Culture to come and do the response. Over to you, Honorable Jerry Maseko.
Asbonge Mdeni. Thanks very much, Deputy Speaker. Greetings to members of the executive present here, Deputy Chair of Chairs, the Honorable Speaker, Dr. Makrupeche, Deputy Chief Whip and Whipari, Mdeni Siabonga Mhlonishwa, Kitamishe Rapele Maliloko, a lekgotla theramolao la rena la mo Limpopo. Deputy Speaker, ka mo kgorong ya rena ya dipapadi bokgabo le setšo, ga mmogo le komiti ya rena, ga re a dula fase, ga re a robala, go a šongwa. Re tlo tšea sebaka se re acknowledge boetapele jo bo fileng ke mopresidente wa rena, Ntate Ramaphosa Matamela, ka mokgwa ba managitšeng March and March ya rena ya maloba. Bontši bja bagaditšong be ba tšere gore naga e tla swa, e fela ka boetapele bja mopresidente wa rena go bonagetše gore South Africa is a constitutional democracy, and batho ba na le tokelo a go ka apply di-marche ba marche and ba tšea responsibility. We are a nation at work, we are a democracy at work as a country, and we must applaud the leadership displayed by our president. Coming back to Limpopo, ke tše sebaka se ke rete mo premier wa rena me Dr. Popira Matuba, boetapele jo a bo fileng re be re a hlahla yona taba ye ya March and March in the inter-ministerial committee. The issues here are the raising tše leng gore di a bonagala gore ka nnete o be a tsebile gore seemo se tlo ba ka tsela ye, and also re mo rete ge a ntšhitše some of the MECs tša rena ba ile gona kwa Mosina go kgontišiša gore lefelo le la ba beilego matšwa ka ntle a seng molaong a swantse gore a ye gae, le be ka mokgwa o leng le gore le kgatla kgoro, le be le di-facilities ka moka tšeo di nyakegang ge re bolokile batho faue, gore go be le smooth transition from South Africa to their respective countries. It takes a leader to do that, and re ba leboga ge ba provide boetapele jo we. But also ke leboge the portfolio committee. If you can check the number of oversight visits that they did, you can see, Honorable Deputy Speaker, it's a portfolio committee at work, and they always keep us to our toes, and we take wisdom and guidance from them, and at all material times they know or we implement all resolutions that they are taking. But just allow me to talk to two things that are very critical. That's one, the issue of the Bloemfontein report. We have indicated very clearly that there is consequence management that is taking place. We have opened even criminal cases against some of the staff members. We are also recouping our money from some of those people, Baba Kolotang department, out of that process. And the final report will be brought to this sitting once the whole consequence management process is concluded. But it is true, Honorable Mabucha, we are losing a lot of not only athletes, including artists, to other provinces due to lack of resources. That's why we continue to make a plea, because we have got plans for additional funding, so that we can develop the necessary infrastructure and ensure that we harvest our athletes and artists. And that's why last in our budget speech, Relevogile Treasury and the legislature, Rebar allocated at least 15 million to begin to design the issue of the high performance sports center. Something that will harvest each and every athlete from the province, where we will have coaches, doctors, psychologists. And by so doing, sure we will not lose our artists and our athletes to Gauteng. Obviously, the theater will also harvest them. Retrobally, the recording studio smaller. Most of our artists are record from home. So we are a department at work, we are a province at work to make sure that we support the much needed talent that we have as a province. With regard to infrastructure, I think we are fine together with our agencies. We've got an oversight technical meeting that meets at least bi-weekly to ensure that we track implementation of infrastructure projects. Arsana Matata ala Rao, and I think given that collaboration between us and the agencies, we will make sure that we conclude all the infrastructures as planned. Cherinchi Itoba Chakamoso, Deputy Speaker, Requele legislature reading through our portfolio committee, and ours as a department is to note and go back to the department and make sure that what was raised here should be implemented by the department, and we are committed to do such. Thanks very much.
Thank you very much, Honorable MEC. We shall now move to item 7.5. Consideration and adoption of the following reports of the Portfolio Committee of Agriculture and Rural Development Committee Chairperson, Me Ramadi Meja, Constance, Kupa Mabuza. Over to you, ma'am.
Thank you, Honorable Speaker. I rise to consider an adoption from the House of the 2025-2026 second quarter report Department on Agriculture and Rural Development. Thank you.
Thank you. Seconder, Honorable MEC, Honorable MEC Rachweni.
No, ke a leboga Honorable the Speaker, Dr. Makurupeche, ke eme mo go seconder se se boletšego ke mmao rena kwa damma Honorable Bella Kupa Mabuza.
Ra leboga, Honorable MEC. Over to you back on 7.5.2. Honorable Chair.
A ke leboge, Honorable Speaker. Tšatši lengwe ke tlo le botša gore ba re ke nna ngwana mma. Ke emeletše mo go kgopela ntlo ye gore e considere ebile e be e adopte the 2025-2026 third quarter report ya Department ya rena Agriculture and Rural Development. Thank you.
Ra leboga. Any seconder to the report? Honorable Piedi.
Thank you very much, Speaker. I rise to second the report represented by Honorable Cooper. Thank you so much.
Ra leboga. We shall now refer to the speakers list. In terms of the speakers list, the Honorable Me Anna Mapula Mkaba, she's the one who's opening the debate for us. Prudence.
Thank you, Honorable Speaker. Honorable Speaker, Honorable Deputy Speaker, the Premier, honorable members in this House, good morning, if it's not, good afternoon.
We rise today to present to you the second and third quarter report of the 2025-2026 financial year. We must be honest that the report are not merely documents, they are a yardstick for delivery, effectiveness, and the ethical use of public resources. In government, result must match comments, and commitment must be backed by action. This quarter reports allow us to assess whether our program are implemented on time, whether performance targets are met, whether spending is aligned to delivery, and most importantly, whether the lives of ordinary people of Limpopo are improving. The African National Congress does not take debates as a means of scoring party points, but to debate to improve governance, strengthen oversight, and ensure that rich communities, especially the poor, the working class, youth, women, and those living in informal settlement and rural areas. Honorable Speaker, the ANC recognized that within this quarter, government has continued to maintain essential public service, implement departmental plans, and pursue administrative improvement to strengthen reporting and compliance. We acknowledge the effort by officials and hardworking public servants who continue to serve despite budget pressure and operational challenges. The African National Congress has also noted the recurring practice that across many departments, that is of the weaknesses reflected in this report, slow implementation and underperformance in several areas. The pace of implementation has not always matched the urgency of the need of our people. Delivery cannot wait for delay in procurement, planning, or internal coordination. Where targets are missed, the department must provide clear reasons, corrected delivery plans with timeline and accountability for avoidable delays. Maybe just to cite some few examples on underperformances. On Program 2, Sustainable Resources Use and Management about disaster risk reduction, the report has indicated that the awareness campaign conducted and their targets was 14, but the actual output was 10. There is a shortfall of 4, and other one is on the Program 3, Agriculture Producer Support and Development. The report indicated that the target of the smallholder support was 500, but the actual output was 268. And these were underperformers. The vegetables commodity support target was 1,358, and the output was 1,215. And on the third quarter report under the very same Program 3, the report indicated that the number of smallholder producer supported was that 45 farmers were assisted instead of the targeted 128. The gap should be closed, especially proceeding to the next quarter of the same financial year. We stated this view once to assess the whole report, especially about underperformance. Reasons are provided by the department, but the targets were set by them, and measures and other means to achieve targets should be looked at by the Executive Authority. Honorable Speaker, on Program 7, Agriculture, Education and Training, especially on the migration of the two colleges, Mazivandlela and Ntombisileka, on Quarter 2, it was highlighted that the committee shall request a progress report in Quarter 3. In Quarter 3, still there is no indication of whether the migration of the two colleges to higher education will happen. The ANC is requesting the Executive Authority on the matter to intervene with speed and report on progress on the resolution tracking. Madam Speaker, on overachievement, which of the cause is an opposite of the underachievement on skills development in second quarter, the department has overachieved on a stipulated targets of 150 by getting 159 while achieving 100% in the third quarter. On Program 4, veterinary,
veterinary services on animal health. In the second quarter, it is indicated that the target of the disease surveillance sample collected was 1,258, but the actual output was 1,634, and it is an overachievement, and it is the third quarter disease, It is the third quarter. Disease surveillance sample collected was also 1,258, but was far exceeded by 3,078. The overachievement come as a result of the reported outbreak of FMD disease, but for planning and financial purposes, the underperformance and overachievements, they do make an impact financially, and other programs might suffer as a result of the process. And in the long run, the department financial control and measures might affect the department to achieve a clean audit. We must emphasize the principle that spending is not delivery. Spending must be tracked not only against budget, but against outcomes. The ANC expects decisive action to ensure that procurement timelines are enforced, professionals and technical requirements are properly planned in advance, and contracts are monitored for performance. Quality and performance, quality and timeline. We also reiterate our position that governance must be strengthened where weaknesses exist, whether in project management, compliance, or internal control. There must be consequence management. Honorable Speaker, finally, the ANC insists that poor performance must be corrected through targeted management support, capacity strengthening where needed, and consequence management where negligence or misconduct is proven. Honorable Speaker, in the second quarter and third quarter report, there are lessons to be learned. Going forward, the province must ensure that the remaining quarters deliver measurable outcome. I thank you.
Thank you very much, Honorable Mukaba. We'll now allow Honorable Moss to continue with the debate. Honorable Moss, you are the next speaker on the speakers list. Over to you, Honorable Moss.
Thank you, Honorable Speaker. All protocols observed. Veterinary services must remain a major priority. Limpopo cannot afford weak animal health systems. Foot and mouth disease, inadequate vaccination coverage, and poor disease surveillance place farmers, trade, and food security at risk. We note that Q3 exceeded the target for FMD vaccination sessions, with 161 sessions conducted against a target of 74, and dipping sessions also exceeded the quarterly target. That is positive, but it must be measured against the scale of risk in the province. The department must ensure that these sessions reach the right high-risk areas, that the communal farmers are properly informed, and that there is a follow-up where vaccination coverage remains weak. The Freedom Front Plus believe that agricultural development must be practical. It must not be reduced to paperwork, targets, and presentations. Farmers need roads that can move produce. They need reliable water infrastructure. They need veterinarian support. They need extension officers who are visible and useful. They need disaster relief that arrives before losses become permanent. They need market access, not just promises. We also want to emphasize food security. In Q3, the department supported 777 households with agricultural food production initiatives against a target of 1,150. This is a serious shortfall. In a province where many families are struggling with the cost of living, food gardens, household production, and small-scale agriculture are not symbolic programs. They are survival tools. The Freedom Front Plus supports agriculture that works. We support farmers, whether commercial, emerging, communal, or subsistence. We support biosecurity, food security, rural jobs, and responsible land use. But we cannot support a system where support is delayed, targets are missed, and rural procedures are expected to carry the consequences of departmental weaknesses. I thank you, Speaker.
Thank you very much. We are now calling the Honorable Kupa Mabuza Constance when she has received minutes from all other members of the committee. So she's not restricted to the 10 minutes because it was official from the committee that I received that report to say other members have donated their minutes to her. Over to you, Chair.
Ka go tamiša speakera, Dr. Makurupecha, ke tamiše motlatša sefepi sa palamente ya gešo ya Limpopo, Ntate Rogers Monama Kanyane, ke boe ke tamiše motlatša badula-ditulo wa rena Ntate Ngobeni, ke tamiše di wipari, ke tamiše gape le bo molekgotla phetiši ba rena ba mo Limpopo, badula-ditulo ba dikomiti ba mo Limpopo legislature, ke tamiše gape le bahlomphegi ka moka. Honorable Speaker, we acknowledge the work done by officials who continue to serve farming communities under difficult conditions, including recurring climatic shocks, procurement constraints, and operational pressures. The ANC remains steadfast that agriculture and rural development must translate public resources into tangible outcomes: more food, more jobs, increased farmer productivity, stronger veterinary, stronger veterinary and biosecurity systems, and improved livelihoods in rural communities, especially for those who rely most on government support. The department achieved 2 out of 3 targets of 66%, including security threat risk assessment and implementation of a communication strategy. However, we must be careful on underspending. The ANC calls for tighter implementation monitoring in Q4 so that the department does not lose momentum on both compliance and service delivery. On agricultural engineering services, we note the infrastructure target of 15 out of 16 was achieved, with the shortfall linked to animal handling facilities completed in Q1. We welcome the explanation and requires that the department ensures that all remaining assets are fully integrated into operational delivery plans. Madam Speaker, Program 3, Agriculture Producer Support and Development. The ANC appreciates the department's work to support producers, but we must underline that producer support is the heart of agricultural transformation, especially to the emerging or smallholder farmers, who they will be able to create jobs. Therefore, underperformance here cannot be normalized. We know that smallholder support targeted 500 but delivered 268. We insist that the department must strengthen supply readiness and contingency planning so that beneficiaries are not left behind. The committee's concerns about the seed delivery timelines, whether outstanding smallholder and vegetable beneficiaries should receive inputs on time, and the formal processes and contingency measures following Cotton SA's withdrawal are all matters that require definitive responses. For extension and advisory service, demonstration-based training delivered 902 against a target of 945, also linked to Cotton SA withdrawal. By contrast, farmers' days were achieved and 36 out of 36. The ANC urges the department to ensure replacement training partners are clearly identified and that Q4 targets are realistic and properly sequenced. Madam Speaker, Program 4 on animal health, veterinary service, we welcome strong performance overall. Disease surveillance sample collection exceeded target. Deep insertion exceeded target FMD vaccination session exceeded target. These overachievements show active monitoring and response to disease risk. The ANC supports this direction and urges the department to continue enforcing disease surveillance and animal health interventions to protect livelihoods and ensure safe animal products, also bearing in mind that the planning stage should dictate the outcome so that we avoid a situation where budget will be redirected to suffocate other programs. One of the examples is that on Program 5, Research and Technology Development Service, research projects implemented were reported as zero in Q2, yet expenditure of 24 million was recorded. That is why we are urging the department to be highly advanced and be the sharpest in the planning stage to avoid other programs to be overachieving at the expense of the other. At the same time, we note positives. Breeding livestock achieved target. Fish breeding stock achieved target, which is also applaudable. Program 6, which is Agricultural Economic Service. The ANC notes overachievement in agribusiness supported wheat marketing service, and we also note commercialization services. The screening process for agribusiness was finalized only in Q2, which contributed to significant gap between the planned 50 and actual output of 10. Program 7, Agricultural Education and Training, the expenditure of 50 million for ICT pillar implementation, upgraded in commendable to an extent that the governing party appreciates infrastructure and connectivity investment. But we must also respect the committee's concern about the latest position on migration of the 2 agricultural colleges to higher education. The department was expected to provide a progress report in the 3rd quarter. We hope we will get progress report in the 4th quarter. Madam Speaker and honorable members, the ANC is encouraged by areas where the department performs strongly, especially in veterinary services and parts of land care and land use management. But we cannot ignore the persistent risk presented by underperformance in key farmer support outputs under program 3 and low expenditure in some of the areas in some of the programs. In conclusion, Honorable Speaker, as the Portfolio Committee, we will ensure that the department remains accountable, responsive and result-driven so that Limpopo's farmers and rural communities can experience real impact. Thank you.
Thank you very much, Honorable Chair. I thought you wouldn't leave. You should come back, Chair, so that we are able to deal with item 7.6 at the same time when you are here. Consideration and adoption of the following reports of the Portfolio Committee of Agriculture and Rural Development, Committee Chair, 7.6.1.
Ke a leboga speakera ke sa buile gape ke tlo kgopela ntlo ye e hlomphegago gore ba considere ebile be ba adopte the report on oversight visit by Portfolio Committee on Agriculture and Rural Development in Waterberg District and Emerpan Red Meat Mega Project on 22 August 2025. Thank you.
Any second, honorable members? Honorable Mnama?
Thanks very much, Honorable Speaker. I rise to support the Honorable Chairperson of the Portfolio Committee on the consideration and adoption of the oversight revisit by the Portfolio Committee on Agriculture and Rural Development in Waterberg District. Thank you.
Thank you very much, Deputy Chair, Deputy Chief Whip. Chair, 7.6.2, over to you, Chairperson.
Re a leboga re sa bušeletša gape, Honorable Speaker, re lekgotla theramelao la Limpopo le considere le be le adopte the report on study tour to Mpumalanga to benchmark on draft nutrition sourcing bid 2024-2025 held from 17 and 19 March 2026.
Any second, honorable members? Oh, Honorable Swapela.
Thanks, Speaker. Ke mo thega pego ya Honorable Kupa.
Re a leboga. Thank you so much. We now go to the 7.6.3. Over to you, Chair.
Re a leboga speakera, re kgopela gape gore ntlo ye e considere e be adopte the oversight visit at foot and mouth disease red line zone in Mopani district on the 22nd of October 2025. A re leboga.
Any seconder, Honorable Mabucha?
Thank you very much, Speaker. Speaker, I second the consideration and adoption of the report as presented by the chairperson of the Portfolio Committee. Thank you very much.
Re a leboga modulasetulo. 7.6.4. Over to you, Chair.
Thank you, Speaker. Ra isale rena gape ba agriculture. Re kgopela ntlo ye ya Limpopo e considere e be adopte the oversight visit in Matsibandlela College of Agriculture on the 21st April 2026. Ra leboga.
Re a leboga Chairperson. Any seconder, Honorable Mhlophe at the back. Ra-
Thank you very much, Honorable Speaker, our doctor. I rise to second the report on oversight visit in Mazibandela College of Agriculture on the 21st April 2026 by our chairperson, Honorable Mabuza.
Ra leboga Honorable Mhlophe. Over to you, Chair. 7.6.5.
Re leboge speakera, re sa bušeletša re kgopela gape gore ntlo ye e considere le go adopta the oversight visit to Tombiseleka College of Agriculture on the 23rd April 2026. Re a leboga.
Re a leboga Chairperson, Honorable MEC.
No, ke a leboga, Honorable Speaker. Re eme mo gape go second-a tše di boletšego ke Maorena mo e leng chairperson ya go etelela pele tša foot and mouth disease ka tše ba di boletšego tša ko Tombiseleka. Ke a leboga.
Re a leboga MEC. When we are in the house, MEC is allowed to second the reports. Yes, so we really appreciate Honorable MEC. Thanks very much. We shall now refer to the speakers list. Me Christian Nkakareng Rakhwale, Honorable, over to you, ma. Thank you.
Thank you so much, Honorable Speaker. When I come here, Honorable Ngobeni says because I'm going to debate on behalf of the Department of Agriculture, I decided to wear a green dress. And honestly, it was just a coincidence. Honorable Speaker, Honorable Deputy Speaker, Honorable Premier, Deputy Chief Whip and members of the WIPARI, Deputy Chair of Chairs, Honorable members of the Executive Council present, officials from the department, honorable members, good afternoon. Honorable Speaker, standing here, I'm not just a member of the Portfolio Committee of the Department of Agriculture and Rural Development in the province. I'm also a deployee of the African National Congress. And it will be very important for the viewers at home to note that on our left side, the chairs are empty. You then ask yourself as to what could be more important than to come to this house to debate the most important reports of the oversight that are supposed to be able to give a direction to our honorable MECs in terms of what has been found or what has been observed on the ground. So we just want to register the disappointment that if you look at it's only Honorable Moss, maybe who take his job serious, but all political parties on our left side, except the African National Congress, is in the house. I think that is worth noting. Many fractions of our society in our province know about agriculture. They want food security, thriving smallholder farmers. And maybe, Honorable Speaker, we must indicate that their minutes should also be donated to us. there shouldn't be a stop today. They want food security, thriving smallholder farmers, decent rural livelihoods, and public programs that deliver measurable results. That is why oversight visit matters. They are not just done for the sake of traveling, they are instrument to test whether policy meets ground or reality. Accountability is highly strengthened when we conduct oversight visits across our province, whether to district offices, farms, irrigation schemes, agricultural infrastructure projects, cooperatives, or extension service point. We must be honest about what we observe. Oversight should answer hard questions such as, are inputs reaching the intended beneficiaries? And are they reaching them on time? Is extension support improving production and livelihoods? Or are communities left to struggle alone? Are there delays in project implementation? And who is responsible for them? And many other progressive questions that will assist the work of the oversight to achieve the desired result. Let us be frank, rural communities lose when oversight becomes performative. The moment oversight turns into a checklist, we will fail the very people it is meant to serve. When we visit, we coordinate findings into joint operational plans where a department and implementing agencies agree on what will be fixed, by when, and how progress will be measured. During our oversight visit to Waterberg District in Emma Planned Red Meat Mega Projects on the 22nd of August 2025, it is the multidisciplinary project that was established by the Limpopo Department of Agriculture and Rural Development with the intention to increase livestock production by addressing production constraints. The project has 24 farms, and the department have funded the project with 6.4 million, and it is implemented into 3 phases. Phase 1 consists of 34 members, or the beneficiaries of the community that are leasing, and 1 community property association farms in a total of 5,415 hectares from the department through proactive land acquisition strategy. Phase 2 consists of 33 member beneficiaries with a total of 8,463 hectares of land that was leased from the department. Phase 3 consists of 30 members beneficiaries, 1 CPA from Madisha, and the department leases as well. The challenges relating to the project were ventilated by the farmers themselves to both the portfolio committee and the department. Just to cite an example, the solar panels were stolen. The infrastructure in the farm, in the form of the office, do not have security. It was evident that the farmers are single-handedly managing their affairs as individual farmers without necessarily collaborating with each other. And the assertion was sparked by the meeting during the visit, where it was nearly turned into an imbizo. And MEC, we really want to implore to you and the department or the office to visit that farm, to be able to try to advise them, to try to work together. Otherwise, the investment by government there is going to be null and void. Madam Speaker and honorable members, on the foot and mouth disease, Red Line Zones oversight visit was on the 22nd of October 2025 at Makuwa and Sabulani and Muninginisi Muyeshe, Red Line Gates in Mopani District. The foot and mouth FMD was well controlled without outbreaks from 2021, and the department deserved an applause for the management of that disease. The zones were characterized by some challenges that needed to be tackled by the department, and amongst them are issues of stolen fence, no guards on the gate, water and ablution facilities, shortage of staff, just to mention the few. And we recommended to the department that guards should be insourced, intervene on water, make proper assessment, and intervene on the fencing. On the oversight visit to Mazibandela College of Agriculture on the 21st of April 2026 and Tombiseleka College of Agriculture on the 23rd of April 2026. Honorable Speaker, our agricultural colleges have similar cases in the main. They share same frustrations and mishaps and the achievements because they are of the same scope. And the similar challenges, among others, vacancy on critical positions, perimeter fence that is collapsing, some of the dilapidated buildings, ablution facilities, to mention a few. We need to mention that a resolution has been taken a while ago in the portfolio committee meeting that the colleges should migrate from agriculture to higher education. We request that our executive authority should look into that. Madam Speaker, somewhere we need to resolve to review our legislations, regulations and frameworks so that to address the issues that affect our people on the ground. During the discussions at Matsibandela, which challenged are almost the same. MEC, I think we were able to indicate the last time we met, but also I took advantage of being a member of the Portfolio Committee of Provincial Treasury to indicate the issue of the account, and that if you check both of them, the produce are still sold on, of course, on regulated prices as regulated by Provincial Treasury, but the question becomes, when last did the Provincial Treasury review those rates? It looks like they're old, because if I was just to give an example, they are selling a chicken, very beautifully fresh chicken, still sold at the rate of around 30 rand. That also tell you that what has been the output versus the input. The chicken is fresh because it's been fed, but what we use to feed the chicken to be fresh, does it not amount or way amount than what has been given there? So on the study tour to Mpumalanga province benchmarking, because in the main it was about, Honorable Speaker, it was about the draft nutrition sourcing bill, which of course is not yet adopted by Mpumalanga, but I think it's one thing that Honorable Speaker and MEC, we think if the department was to get closer to that, it can be able to assist the emerging farmers and farmers in general. So I want to take this opportunity and say to you, MEC, get closer to that situation, because already I'm sure you are aware that the president will be opening officially the Mpumalanga food market. Very huge, a very big infrastructure. So the question becomes, will we not lose our farmers to Mpumalanga by the time we construct our own? I think it's one of the issues that we might need to look into. So I want to take this opportunity, Honorable Speaker, and move that this report be adopted to be the report of the House. Thank you.
I'm happy that today you are enjoying all your minutes without being stopped. Thank you so much, Honorable Rakhwale. We shall now allow Honorable Moss. As
Honorable Speaker, we've agreed with the Honorable Chair that she will do the debating on behalf of the committee.
Thank you. Honorable Chair, please come and close. You have got limited time to debate from all your members of the committee. Over to you, Chairperson.
Re a leboga speakera a re dire so mara re be re bontšhe gore that's how we are united in in agriculture, because we care about our communities. We love our community. We sit down as portfolio members. Everybody just inject in the report and satisfy themselves. That is why we want to have 30 minutes. Honorable Speaker, Dr. Makrupecha, Honorable Deputy Speaker, our Deputy Chief Whip, our Deputy Chair of Chairs, the WIPARI, the MECs, the chairpersons of portfolio committees, and the honorable members. Our officials, the head of departments, and the viewers at home. Madam Speaker, this year marks a very significant and unparalleled testimony in our country's memoir and history as we celebrate the 30th years of the Constitution of Republic of South Africa that was adopted some time ago on the 8th of May 1996. Our country have endured a very difficult past from more than 350 years of colonization and apartheid ruling, which all these events of our past calendar came to rest immediately during the proceedings and negotiations that led to the CODESA, which ultimately produced the draft constitution and in the end, the final document of the constitution. Our constitution is rated one of the best in the world and one distinguishable factor that elevate it to the highest echelon in terms of rating is the inclusion of the Bill of Rights. Honorable Speaker, the journey post-democratic dispensation was remarkably fulfilling to the South African society and the world in general because of the sitting and the constitutional democracy that we are enjoying. The system have been set, the legislature, executive and judiciary, and many other bodies that are guided by our constitution. Madam Speaker, the people of South Africa are living in peace and harmony. They enjoy the fruits of freedom. By celebrating the 30 years of Constitution, it does not mean that our country does not have challenges. It is a work in progress. The achievements that came with the adoption of the Constitution, including all the systems that were put in place to run this country, were remarkable. Honorable Speaker, the Portfolio Committee conducted an oversight visit which was scheduled for the 22nd October 2025 to the foot and mouth disease red line zone at Makuva and Mninginisi red line gates. I'm sorry, but in the Mopani district. We undertook this visit to assess the implementation of the provincial foot and mouth disease control strategy, review performance against program targets, and identify gaps that may threaten the continued FMD-free status of the affected areas. The Mopani district have been allocated approximately 6 million from the provincial FMD strategy. However, several challenges remained, most notably illegal livestock movements, fence thefts and fence breakage, sometimes the delays in vaccine delivery, community non-compliance with vaccination and movement restrictions, critical infrastructure challenge, particularly the compromised red line fence. The committee is of the view that there is a need for an urgent intervention to address vulnerabilities that could reverse progress. The committee was informed that the area remains FMD-free, with the last confirmed case reported in 2021, and that control measures are continuous. Some of the observations and the findings of the committee was that in Makuva and Mninginisi, red line zone fence was found to be stolen, but then the department explained that fencing is a national competency, but the committee emphasized that local implementation risks remain within the provincial operational environment. Therefore, a committee further recommended a design review of the fence and suggested use of a bright color to reduce community theft. Honorable Speaker, on oversight visit to Tombisileka College of Agriculture on the 23rd of April 2026, we assessed progress made on the refurbishment of the 6-story building as well as other priority projects that directly affect training delivery, student accommodation, and the practical agricultural learning environment practitioners. On critical vacancies, amongst them is the position of the vice principal, academic, the head of Department of Animal Production, and the Human Resource Management component. The college indicated that these vacancies have had an impact on academic delivery, with parts of the academic function elegantly being managed rotationally and on acting arrangements. Honorable members, this is not a technical issue, it is a risk to institutional stability. When academic leadership and program coordination are repeatedly disrupted, it weakens planning, quality assurance, and the consistency required for practical training discipline, particularly in animal production and laboratory-based learning. The committee therefore stressed that these are not just routine vacancies. They are strategic posts that sustain educational continuity and operational credibility, and therefore an intervention is needed to address it. On the infrastructure need, perimeter fence and ground landscaping, street lights and high mast light, agro-food processing laboratory, ablution facilities at the library and hotels, and irrigation system. Additional needs include sports and recreational facility in Ntate Maseko. Bana ba lekua ba re ba hlaelela ba kgone go itšhidulla. Jwale re tlo fapana le Ntate Maseko ka tše re di dirang, Honorable MEC. Library upgrade, academic laboratory, the farmer training center and aquaculture ponds. This shows that the infrastructural challenge is not isolated. It affects security, learning quality, student life, and productive capacity all at once. On partnership, the college reported partnership with UNISA, Capricorn TVET, Skukune TVET, Nozala Trust, AgriSita, and the Department of Agriculture. These partnerships have potential for articulation, training support, resource mobilization, and industry linkages. However, the college did not clarify the measurable outcomes of these partnerships, so as how many students benefit and what resources have been mobilized to address infrastructure and production constraints. The committee therefore requests from the department on clearer reporting and outcome-based evidence of partner impact. The portfolio committee observation and findings were that capacity and accommodation crisis in Tombisilika is currently under severe capacity pressure. The college is currently reportedly over-enrolled relative to accommodate capacity, resulting in student sharing rooms, placing strains on residential facilities. The committee also highlighted that the college received approximately 2,000 student applications, but only admitted 70 students, primarily due to lack of student accommodation. This means the institution faces both constrained intake and overcrowding, critical staffing pressures which risk the absence of permanent academic leadership, discontinuity of laboratory services, and impact practical training programs. Honorable Speaker, based on the findings of the oversight visit from the Portfolio Committee, they recommend that the department and relevant implementing authorities ensure that all generated revenue is utilized to strengthen financial sustainability and enhance the practical training platform. Submit a comprehensive plan to align infrastructure with enrollment growth, given the college operates above its stated facility capacity, address the staffing crisis by permanently filling all vacant posts, including vice principal, academic, animal production, and human resource management, and create more positions for cleaner and general workers. These were recommendations amongst many that were stipulated. Honorable Speaker, on oversight visit to Mazivandila College of Agriculture that was scheduled on the 21st of April 2026 at Vembe District. The most critical and recurring concern is staffing. The vacancy rate remains unacceptably high, with funded posts not yet filled permanently. We also know that the parts of this challenge are linked to the pending job evaluation process under DPSA, which has delayed advertising and filling of key posts. We are particularly concerned that this directly affects academic delivery, farm operations, laboratory support, and student welfare. A training institution cannot be expected to perform at the level required for its mandate without the full staff complement that makes quality and safety possible. We must speak plainly about infrastructure and security. While some facilities are reported to be in good condition, other critical assets, workshops, laboratory, ICT infrastructure, roads, fencing, and staff accommodation remain inadequate or in poor condition. The security fence and ICT and security upgrade projects are not progressing as they should. This is not just an operational inconvenience, it is a risk to students, staff, machinery, and learning assets. If the environment is unsafe, effective training cannot be sustained. Thirdly, we noted that financial allocations do increase over the years and expenditure level are largely high. Yet we also observe that development-oriented investment, especially in infrastructure maintenance and practical training resources, receive disproportionately limited portions of the budget. We therefore caution against spending patterns that absorb funds into recurrent cost while practical capacity, maintenance backlogs, and learning facility remain compromised. We were told about the college's position on revenue retention and transactional accounts, including the long-standing administrative obstacles to activating transactional banking functionality. We recognize that these constraints affect sustainability and the ability to respond quickly to training and operational needs. We also urge the department to intensify collaboration to resolve access roads, signage, land and government arrangements, and to strengthen operational links with municipality and institutions of higher learning. Honorable Speaker and honorable members, the department and the college should therefore provide clear feedback on progress, corrective actions, and milestones with measurable outcomes that speak to improved practical training capacity, student safety, and enhanced employability. On oversight to Waterberg District Emerpan Red Meat Mega Project on the 22nd of August 2025, the expectation of the Emerpan Red Meat Mega Project is to maintain and sustain the red meat value chain and the accessibility of the red meat to safeguard food security. It has some challenges as they were presented by the farmers in the venue. Amongst them are as follows. Water is one of the major challenges. Just to cite one example, in phase 1 and 2, there was supposed to be a borehole that is of 200 meters in depth, but it was 350, and it was not completed as outlined in the specifications. And moreover, a contractor, after being paid in full, they abandoned the project. Madam Speaker, the Portfolio Committee is not pleased on how the issue of water unfolded, given the fact that Emerpan is one of the mega projects in the red meat. It is going to be compromised and end up collapsing. We request the executive authority of the department to prioritize it and intervene timelessly. A contractor should be brought back to complete the work. Fire fleas that infect cattle with diseases, it was raised by the farmers, and a suitable solution is that of immunization and vaccination of the livestock to maximize the livestock production. A suitable function that a departmental veterinary should provide. Farmers are unable to pay farm cares from their pockets. That create a challenge because according to the Portfolio Committee, the expectation was that farmers were supposed to be self-sustainable while they are not. We are hopeful that the department will develop a specific program that will respond to the recommendations that were raised during the visit, such as to provide a training program to the farmers, to meet with farmers on a regular basis to develop mechanisms that will assist them to start producing meat, to provide immunization and vaccination to the livestock, to assist the farmers to have a security, to address the network issues that will enable them to communicate freely and smoothly, to assist them with market access, to provide adequate water to the farms. On the Mpumalanga study tour, that was scheduled from the 17th of the 9th to the 19th of March 2026. The intention of the tower was to get and learn best practices in other provinces, especially about how they implement projects in the main. The benchmarking was in relation to a draft nutrition sourcing bill. But additionally, we got to explore the beauty of the agricultural sector by going to the international food market, agri-hubs, and many other related stuff. The legislative intent and why this work matters, honorable members. The proposed bill and the underlying policy direction are incurred in a clear constitutional purpose. Our democratic era is premised on measures and legislation to address historical imbalances created by unfair discrimination. In practical terms, this means we must ensure that black farmers and rural producers are not excluded from the system that determines production, pricing, and market access. What Mpumalanga has consistently highlighted is a reality that we all recognize. Value chains are often structured in ways that privilege those already positioned within cities, established retail network, and formal commercial systems. Rural communities, land reform beneficiaries, and smallholder typically remain consumers rather than producers in these systems. Or they are producers without meaningful access to formal market. That imbalance is not accidental, it is structural, and it must be corrected through legislation, regulation, and targeted support. Rationale and objectives of the nutrition sourcing approach members, the rationale presented to us is compelling and urgent. Primary producers often do not have comparable access to land, finance, equipment, and market infrastructure. Rural and land reform beneficiaries face limited participation across aggregation, distribution, and sales. Market power is concentrated with dominance by a small number of retailers, leaving small producers without leverage. Accordingly, the bill's objectives are aligned with inclusive economic transformation, support emerging farmers, enhance market access, revitalize land reforms, create jobs and reduce poverty, grow the provincial agricultural economy through structured demand channels. Honorable members, the discussion on communal property association should be treated with seriousness and urgency. The core concern is not simply that CPAs exist, but that's the CPA framework as not simply that CPA. But that the CPA framework as implemented in some instances has sometimes failed to protect productive potential and community interest. We had concerns that lease agreement must be scrutinized rigorously, including evidence of consultation and consent from community members, CPA members or landowners. The CPA phenomenon with the portfolio in Mpumalanga, the challenges that we have are similar, and one of the resolution of the Joint Portfolio Committee meeting was that we need to all, as separate committees, write to the Minister of Agriculture about the matter, and if possible, request a meeting where the matter on the table shall be the CPA. We also must ensure lease term protect long-term communal value and developmental objectives, not only short-term commercial extraction. The committee rightly raised frustration about implementation challenges, including capacity constraint, internal disputes, and outcomes that undermine livelihoods. The examples referenced by the committee are therefore not just case studies. They are warning signals that without corrective measures, land reform can unintentionally disempower communities further. On exploring the nutrition source bill in relation to the market access as the decisive factor for a smallholder, the most important lesson from the briefing and discussion is that production alone does not guarantee improved livelihoods. Small-scale farmers need aggregation mechanisms, reliable buyers, logistic and compliance support, food safety and traceability readiness, and sustained technical support to meet market standards. In our province, the same challenges we identify is that farmers often lose quality because they lack of consistent and accessible market channel. When smallholders cannot sell in time or cannot meet specifications, the entire system breaks at the point of value capture. What Mpumalanga Food Market model teaches us is that the Mpumalanga International Food Market is not merely an infrastructure project. It is an institutional mechanism to coordinate supply, enforce quality pathways, and formalize market access. We were informed that the model operates through accredited market agents using a commission-based trading approach, and that Mpumalanga International Food Market is intended to become a center pivot for coordination for institutional procurement such as National School Nutrition Program and hospitals in Mpumalanga, sometimes that were to be replicated in our province. The practical benefit for us is clear. When government demand is structured, predictable, and linked to the local supply capacity, farmers move from informal vulnerability to formal opportunity. That is why the committee view Mpumalanga's model as transformative and recommended benchmarking to strengthen world-class learning in market models and agricultural technique. Agri-hubs and one-stop center as enabling infrastructure, honorable members. We also toward to Mukondo Agri-hub and the Mukondo one-stop center. This structure demonstrated that agricultural development requires more than farms. It requires an enabling ecosystem, access to technical advisory services, inputs and support, veterinary services, mechanization support, logistic and packaging capability, and coordinated consolidation of produce. We also noted challenges, particularly the limited availability of produce from smallholder farmer and issues relating to produce quality. That observation is extremely important for our province. It tells us that market infrastructure must be paired with production planning, quality improvement pathways, and continuous farmers' readiness programs. Without those, even well-designed markets will struggle to sustain volumes and compliance requirements. The recommendation with a clear way forward for our province, the benchmarking and site visit resulted in recommendation that we must now translate into a concrete Limpopo plan. In our view, among the priorities are as follows. On CPAs, convene a joint engagement with the relevant ministers and structures to address CPA implementation limitations and unlock production communal land use. Nutrition bill and food market learning. Benchmark Mpumalanga nutrition source framework and food market implementation so Limpopo can design a context-responsive model. Planning for provincial markets, begin planning for a provincial food market so that Limpopo can build an institutional demand pipeline for smallholders. Sourcing framework feasibility. Must conduct a feasibility study for a Limpopo-specific sourcing framework or bill based on Mpumalanga lesson and Limpopo's realities. Linkages and compliance. We must strengthen linkages between agri-hubs and the government nutrition program, ensuring food safety, traceability, and farmer readiness for formal supply chain. As I conclude, Honorable Speaker, Mpumalanga has shown us that inclusive agricultural transformation becomes real when we connect four elements: land and producer empowerment, production planning and quality, aggregation and logistic, and reliable institutional demand. Our task is to ensure that our Limpopo does not merely learn but implement. We must turn benchmarking into legislation, oversight into corrective action, and infrastructure into sustained livelihoods for emerging farmers, rural communities, and Black agricultural entrepreneurs.
We are very happy, Chair, that indeed doing study tours is not a waste of money. Thank you so much. And we're happy that the committee has agreed to give all the minutes so that you can share with us what we have learned. We now take the opportunity to allow the Honorable, the MEC, MEC for Department of Rural Agriculture and Rural Development, Honorable MEC May Grace Nakedi Kekan.
Thank you, Honorable Speaker, Premier, ESCO members, WIPARI, and honorable members, and those on virtual platform. Allow me to express my appreciation to the chairperson and members of the Portfolio Committee for the diligent efforts to playing an oversight work and hold executive accountable for 2025-2026 financial year, second and third quarter report, followed by the oversight visits. We acknowledge issues raised and most of the targets not reached were amicably resolved in the fourth quarter of 2025-2026 financial year, which has seen the department spending 99.6% and achieving all the targets with the exception of Program 2, where we have achieved 80% and the remainder was due to the refurbishment of irrigation infrastructure affected by floods in Waterberg, where the water is not yet dried out, leading to our borehole machines not to operate effectively. On oversight visit, Honorable Speaker, Emerpan Red Meat Mega Project in Waterberg, the committee's observation reaffirmed government's commitment to revitalizing the livestock economy and expanding agro-processing capacity within the province, and that's resulted in the drilling of 4 boreholes. On oversight visit on foot and mouth disease, red line zone areas. Collaboratively with the Limpopo Department of Economic Development and Kruger National Park, the procurement for the erection of 21-kilometer fence is underway and at an advanced stage, which will see more jobs be created and our animals be prevented from foot and mouth disease emanating from stray animals like buffalo encroaching our space. The challenges raised on the theft of solar has been reported with law enforcement agencies, and the refurbishment of our pollution facilities is underway. In foot and mouth disease, the department appreciates the committee's recognition of the significant efforts undertaken to contain the foot and mouth disease outbreak. Since the outbreak, various strides have been made to cap the disease as indicated in the member statement before. However, while progress has been made, biosecurity remains a shared responsibility. We therefore urge all livestock owners to continue complying with movement control measures to safeguard the provincial livestock economy. On oversight visit to the 2 colleges in Mazibandela College of Agriculture and Tompisileka, the department acknowledges the committee's recommendations regarding infrastructure governance, academic programs, and institutional development, and we remain committed to modernizing agricultural colleges to meet the skills demands of a competitive agricultural sector relevant to the current economies for food security and economic transformation. On refurbishment of the 2 colleges is up and running with the Department of Public Works meeting its target for completion. Honorable Speaker, following benchmarking of best practices by the Portfolio Committee, include in Mpumalanga, the department has now finalized the signing of the Memorandum of Understanding with the Limpopo Department of Agriculture to implement the homegrown school feeding model by linking the emerging farmers and small-scale farmers directly with the school nutrition program and assist them to expand and be mainstreamed in the economic value chain. This model will further expand to other departments like health, social development, and correctional services. Pertaining to the provincial fresh produce market to realize the value chain, together with LEADED and strategic investors pledged during the conference, we will look into this matter. However, the district fresh produce market in Vembe is underway for finalization, which will also include the agro hub in Blowberg in collaboration with Venetia Mine. Migration of colleges to the institution of high learning. The matter is receiving attention with the 2 ministers and development are at an advanced stage, and this progressive move will empower the fellow learners from the poor of the poorest to access NSFAS funding as the Department of Higher Learning will take over the curriculum function while the National Department meeting the constitutional mandate by making sure that they take over the administrative mandate. Together, we are building a food secure, prosperous, and inclusive Limpopo. Re a leboga.
Re a leboga the Honorable the MEC for responding to the debate. We shall now move directly to item 8, response to parliamentary questions. 8.1. The following parliamentary questions have been responded to, and the answers are published on the ATC dated 1 July 2026, are therefore disposed of from the question paper. 8.1, question 1, 20, 24, 26, 27, and 31 of 2026 for written reply by the MEC of Agriculture and Rural Development. 8.2, question 5, 6, 7, 21, 24, 29, 31 of 2026 for written reply by MEC for Economic Development, Environment and Tourism. The questions are disposed of accordingly. Item 9, are there announcements? Honorable Deputy Speaker.
Thank you very much, Madam Speaker. Greetings to the Premier, the members of the Executive Committee. Let me greet the Chief Whip, Deputy Chief Whip, and the entire whippery. Let me greet the Deputy Chair of Chairs. Let me greet all the chairperson of portfolio committees and all honorable members. And also to you, Honorable Moss, especially that you are alone. Let me greet you singularly, so. But greetings to you. Thank you very much, Madam Speaker. Honorable members, I wish to make the following announcement. When this August House adjourned today, it will sit again on Tuesday, the 28th July 2026, in the Leboa Khomo Legislative Chamber. Lunch for honorable members and guests shall be served in the main committee's boardroom after the adjournment of this House. Thank you very much, Madam Speaker.
Thank you, Deputy Speaker, Honorable Meg Race, Mam Robert. I thought honorable members will give you a round of applause, just you are giving them some kind of a recess. Thank you. Thank you so much. We thank you, the Chair and the Committee of Programming, for giving us space to breathe a bit. But that does not stop the work of committees. We take this opportunity, honorable members, that at least we have now come to the end of our session. The hard work that has gone through, we indeed thank honorable members. It's unfortunate that the members on the left, they are not here when we did the final debate. We must encourage them that as and when they debate, this is the stage for the debate where we are supposed to engage with our own communities. Honorable members, I take this opportunity to thank you so much and say this House is adjourned to Tuesday, 28 July 2026 in this Leboa Khomo Legislative Chamber. The House stand adjourned. Thank you so much.